Hi, everybody. Welcome. My name is Melissa. Welcome to the satellite session towards a transdisciplinary research agenda on anti-science. My name is Melissa Salm, and with me today are Doctors Caitlin Cilio and Shama Patel, my co-organizers and co-hosts for this event. On behalf of the CUGH Research Committee, we would like to thank all of you for joining us today. This four-part workshop is dedicated to introducing and interrogating the problem of so-called anti-science and to proposing the need for a transdisciplinary research agenda into this complex and emergent area of inquiry. Global health researchers, spokespersons, and public commentators increasingly use this word, anti-science, to describe rising trends worldwide of public distrust of scientific institutions and public health authority. However, certain things remain unclear, which we hope to address today, namely, what sorts of phenomena ought to be categorized as anti-science, and how ought we to research anti-science in such a way that increases our understanding of the problem. To help us gain some clarity on these questions and to achieve our objectives for this satellite session, we have invited experts from different parts of the world spanning the disciplines of public health, medicine, the social sciences, and communication to share their conceptualization of anti-science and to describe their research into different dimensions of this multifaceted phenomena. We've purposely chose to present this in a workshop we chose to present this workshop in the satellite session forum so that it is accessible to the public and open to a collective discussion on these questions. Okay, here is a slide of our agenda for the day. It is composed of 4 parts with a 10-minute break scheduled in between. In part 1, you will hear from a panel of speakers addressing a narrow dimension of anti-science related to vaccine hesitancy and mistrust of public health authority. In part 2, you will hear from a different panel of speakers addressing broader dimensions of anti-science related to populism, climate change denial, and the role of the media in the spread of misinformation. The following format will be repeated across parts 1 and 2. Panelists have 5 minutes each to introduce themselves and their research orientation, followed by a moderated discussion, followed by an extended Q&A. So everyone, please use the chat function to submit your questions to our speakers, and we will try our best to facilitate as many of your questions as we can, given time constraints. Parts 3 and 4 are more interactive, so please do stick around. In part 3, you will hear from Michael Spector, an acclaimed science writer for the New Yorker magazine, followed by a breakout activity for discussing opportunities and challenges inherent to the task of rebuilding public trust in science. In parts 4, we'll break into smaller groups again and try to apply everything we will have learned today towards collectively designing a transdisciplinary research agenda into this problem moving forward. Before I say any more about the subject matter itself, allow me to clarify our rules of engagement during this workshop. We will be publicly discussing topics that tend to elicit contentiousness. We want to avoid that in this forum and instead to facilitate a nuanced, reflective, slow, humble inquiry into the matter at hand. Responsibly facing the problem of rising public distrust of science demands that we eschew certain assumptions, among them that research scientists are the only ones or the right ones to speak about what to do in society, which is where the problem of anti-science often manifests. We are honored to have our speakers visit us today, and we are grateful for their participation, and we will listen to them since they are well prepared to shed light on this topic. But it is also important, especially during the breakout sessions and the Q&A, to embrace plural perspectives, be respectful of differing viewpoints, and to temper ourselves when responding to one another. If you are rude to fellow participants, or if you display audio-visual content that is disruptive to the flow of this workshop, we will kick you out of the event. This applies to everyone, no matter how righteous you may feel in your perspective or how justified you perceive your position on the topic to be. Okay. So I'm just going to go through this quickly since I would like to get to our speakers. So I am a member of the CUGH Trainee Advisory Committee, and in that capacity, I joined the CUGH Research Committee, where on day one, I unwittingly volunteered myself to lead the working group on anti-science. And as part of this endeavor, I conducted a literature review with some of my colleagues in the Trainee Advisory Committee, Elizabeth Frost and Martha Bravo, into this topic of anti-science. And we found that anti-science tends to be analogized with a wide variety of things, like negative attitudes towards science, adversarial claims of objectivity, epistemological anarchism, right-wing fundamentalism, moral uncertainty, unfounded theories, to name a few. But in short, anti-science is a kind of catch-all, a kind of colloquialism that is often used as a pejorative label for characterizing a wide range of attitudes and activities that challenge the validity of scientific knowledge and the social prestige afforded and granted to scientific expertise. We also found that some expressions of anti-science do include denunciatory protestations against scientific method and evidence-based reasoning, but it would be naive to assume that anti-science is merely in opposition to facts or to even to science per se. We live in a world where there are many conflicting types of facts, and whether we like it or not, very often scientific facts are not easily separable from social values, especially when scientific facts are made to steer political decisions impactful to individuals' experiences of public life, as was the case, for example, when politicians followed the science in order to enforce public health measures during the COVID-19 pandemic. So we want to, I'm just repeating our guiding questions. We want to treat these as open-ended. And I'll just conclude by saying some, actually, I'll save the last slide for my closing remarks, but we can stop there and segue into our speakers.
Good morning, everybody. My name is Shama Patel. I'm going to be leading the first panel talking about vaccine hesitancy. So we have a very esteemed group of 5 panelists. I'm going to have them introduce themselves. First, just in this moderated session, we have invited experts from varying disciplines to expand upon their conceptualization of anti-science and their methodologies for understanding and or intervening on the phenomenon. To start off with, we'll give a 5-minute time limit for introductions and really framing the anti-science question by our panelists. Afterwards, we'll have a 10-minute moderated discussion, 15-minute moderated discussion on some guiding questions, and then a 10-minute Q&A, hopefully from the audience, responding to what has been talked about in the panel. So I'm going to start off with Dr. Hotez, please, 5 minutes introduction and what you view as the anti-science, so we're calling it, problem.
Okay, sure. Well, thanks for having me, and it's great to see my fellow panelists and everybody else. So I'm an academic. I'm an MD, PhD vaccine scientist. I'm a professor at Baylor College of Medicine in pediatrics and molecular virology. And I'm a dean of our tropical medicine school. And I also co-direct our Center for Vaccine Development. And we develop vaccines for poverty-related neglected diseases, but also coronavirus vaccines that we started about 10 years ago. And now we have a low-cost COVID-19 vaccine that's accelerating across India. It went into 1.8 million kids 12 and up last week. So we're very excited about that. The other, excuse me. The other aspect is been going up against, sorry, my mouth's a bit dry. I don't have COVID. I've been going up against anti-science for a number of years. Excuse me. Because I am a vaccine scientist and I have 4 adult kids, including Rachel, who has autism and intellectual disabilities. So I wrote a book. I wrote a book a few years back called Vaccines Did Not Cause Rachel's Autism, which made me kind of public enemy number 1 or 2 with anti-vaccine groups for a number of years. So I've had a front row seat to watching the anti-vaccine movement kind of unfold in the United States, and how it, began with kind of grassroots groups making false claims that vaccines cause autism, but now accelerating into this whole anti-vaccine ecosystem here in the United States, and watching it take on kind of a political dimension over the last decade, which really the wheels came off over the last couple of years during this COVID-19 pandemic. And now I think that's become a dominant theme of the anti-vaccine movement in the US. It's this kind of link to far-right extremism. So you're seeing the Proud Boys march with the anti-vaxxers at the rally in Washington, DC. You have the Fox News anchors at night going on these rants against vaccines and vaccine scientists. And, I had to endure a couple of weeks ago 3 successive nights of Tucker Carlson, Laura Ingraham going after me on Fox News for what I wasn't quite sure about, but it was, we're seeing this link to far-right extremism and portraying not only science, but also scientists as enemies of the state. And you're hearing from members of the U.S. Congress at the CPAC committee saying that first they're going to vaccinate you, and then they're going to take away your guns and your Bibles, and this kind of rhetoric. And even though it sounds ridiculous to us, there's a part of the country who believes it. And the point is, it's more than an academic or philosophical discussion. And I'll make my last point, which is that since May of last year, between 200,000 and 250,000 Americans have unnecessarily lost their lives because they refused to get vaccinated despite the widespread availability of COVID-19 vaccines. So the point is, whatever you want to call it, anti-science or some other term, it's a killing force in the United States. And anti-science in that sense is now a leading killer of young and middle-aged adults in the United States. And when we think about the big things that we put up infrastructure to combat, like global terrorism or cyber attacks or nuclear proliferation, we don't really think of anti-science in this term, but it's killing more Americans than all those other forces combined. So apology for the coughing fit, and I feel fine, and I'll stop there.
Thank you so much. And no worries about the coughing bit. So Dr. Ahmed, will you go next?
Yes, and thank you very much. Can you hear me?
Yes, he can hear you great.
Okay, great. So my name is Tahmid Ahmed, and I'm Bangladeshi, and I'm talking to you from Dhaka, which is the capital of Bangladesh. Like Dr. Hotes, I am also an MD PhD. I studied medical science in Bangladesh, joined ICDDRB, which is a strange acronym that stands for International Center for Diarrheal Disease Research, Bangladesh. That was in the 1990s, many years ago. Then I did my post-graduation in Japan, came back again. I did my residency in pediatrics and continued to take care of patients and be involved in clinical research. For the last 30, 35 years, I've done work on child and maternal malnutrition, as well as infectious diseases. Right at this moment, I'm the executive director of ICDDRP, which is an international organization, taking care of research agenda that involves people living in low and middle income countries. We started with diarrheal diseases, and that's why we have the largest diarrheal disease hospital in the world in Dhaka. But now We have gone into social science. We have gone into non-communicable diseases. Of course, vaccine is there, COVID-19 and many other infectious diseases. I was intrigued when Professor Judith Wasserheit told me about this session. And I readily agreed to be a panel discussant because I thought that this was very important, particularly for myself living in a country where there's so much of anti-science. And then I also read Dr. Hote's publication article, I think that was in Science. And to me, that was pretty insightful. As a medical doctor working in a developing country, to me, anti-science is anything that goes against evidence. And I can give you examples. As I said that I work on child and maternal malnutrition, I have to work on interventions that can take care of this dreadful problem that spans across the globe. But I can tell you, whenever you come up with interventions, you will always have people who think against the evidence. And that to me is anti-science. Several years ago, we developed an intervention based on locally available food ingredients. Because when you want to have the conventional, traditional treatment, you have to import it, which is pretty expensive. When we did that intervention locally, we were surmounted with a lot of criticism. And there were, thoughts about the intervention causing overweight, obesity, that the intervention might offset breastfeeding, all these things. And these are not at all, based upon evidence, rather against evidence. And that to me is sheer anti-science. When COVID-19 came in, this is a country where we had a lot of debate between urban and rural. Those who lived in urban areas, particularly in urban slums, they thought that, well, COVID-19 is a disease of the rich. They should not bother about masks. They should not bother about vaccines. And again, people who lived in rural areas, they thought that, well, that's a disease of urban areas. Why should we bother so much about it? So that was anti-science. But then, when COVID-19 also went into the hinterland and caught everybody unawares in rural areas, people started to realize that, no, that's wrong. By the way, Bangladesh is a country which is very, very vaccine friendly. Why? Because several years ago, also, the infant mortality rate was very, very high, one of the highest in the region. One thing that the country has done tremendously great is EPI, that stands for Expanded Program on Immunization. Because of this, people took up vaccines. They understood that if they can give vaccines, shots to the children will survive. And more so, the boys will survive. Because again, this is a society where, unfortunately, boys are more valuable than girls. But people realize that, yes, vaccines are very important. So there's a culture of people taking up vaccines. So when the government of Bangladesh purchased COVID-19 vaccines, from the open market, reminded a country like Bangladesh purchasing vaccines against COVID-19 and giving it for free across the population, certainly there was hesitancy. But gradually people, even the poor, they realized that, yes, if they take the vaccine, they are not going to get attacked by COVID-19. Even if they do, they are not going to be hospitalized, something which is pretty expensive. So people, they tend to stay away from hospital, which again is a great thing. And I think this has proved that although there is a lot of anti-science, but there is also, a sense of, goodwill for the right thing to be done. And this happened with the COVID-19 vaccine. I think I'll stop
Yeah,
here.
perfect.
Thank you.
Thank you so much. Dr. Larson, if you would mind going next. Oh, you're still muted.
And this time it wasn't the host blocking me. Thank you.
No.
I'm Heidi Larson. I'm an anthropologist, and I work a lot on risk and decision science, how cultural, social, political issues affect people's decisions. And I founded the Vaccine Confidence Project 12 years ago after working with UNICEF globally on introducing new vaccines and launching Gavi and working on polio eradication. And during that time, I saw a growing amount of questioning around the world, which I felt was needed attention or needed understanding, I should say. And I felt like from a communications perspective, we were throwing a lot of communication at a problem we didn't really understand. In fact, I had a sign on my desk: communication can't fix a problem you don't understand. And so I've built a multidisciplinary team, mathematical modelers, computer scientists, political science, anthropology, psychology, and we're looking around the world and mapping and what are we finding that is driving vaccine hesitancy and questioning, or we framed it as confidence. What is it that builds confidence? What is it that breaks it? I like that framing better. Feel like it has a bit more positive spin, or at least has the opportunity for a more positive spin. But we and we've seen the world go up and down in different countries and in different places in terms of their sentiments around vaccines. One big change we've seen in the last 12 years, and we've developed a confidence index that we watch it move over time, is that it does go up and down. It's not like there's an upward trajectory of building confidence or a massive drops, people increase again. So I think one of the things that we need to pay attention to is the ups and downs of sentiments and trust. And I was interested in the introduction, which was defining, in a sense, anti-science as public distrust, or framing it that way. And I think we've got a major trust issue personally, and I wouldn't necessarily equate it as anti-science. What I find fascinating about the term anti-science, and we faced a lot of this type of resistance of science during AIDS, in Ebola. This isn't the first time we've been confronted with, I would say, science skeptics, but it's all intertwined. The first anti-vaccine league was a basically compulsory vaccination league. The anti part was against the mandate, not about the vaccine. So I think it's great that we're having this discussion today to try to unpack that a bit. I think that we have to keep in mind, as much as we as scientists are holding on to evidence and science, and it is absolutely foundational and fundamental to what we do, we have to remember that people do not always make their decisions based on science. In fact, they rarely make it only on evidence, only on science. And until we can contextualize what that science is in a way that somehow, or at least try, that fits into values and culture and politics, we're going to have a problem. And what's happened in our focus on evidence and science, and particularly in COVID, science says, therefore you do. The public, in the research we're finding, kind of sees science as the new dogma. It used to be religion, and science was free thinking, and now it's science and people are going back to their ideologies. So somehow we have to find something along this path. The bottom line is what Peter said, which is this situation, whatever we call it, is killing people. And that's really where we've got our problem, and how we tackle this. It'll be, I'm really looking forward to the discussion, because I think it's a process. It's about, anti-science can be about individuals, it can be about institutions. At many levels, it's about authority, and it's against a notion of freedom of choice. I'll stop here because I know we have a few minutes, and actually it's the discussion I'm really interested in.
Thank you so much. Dr. Tikimana, if you would like to go next.
Thank you very much, Shama, for this opportunity. I'm John Tikimana, talking from the DRC, the Democratic Republic of Congo. As my colleague said, I'm a MD, PhD, an associate professor at the Kinshasa School of Public Health in DRC. So this is a very important topic, and I'm happy to provide some perspective from the Central Africa and Sub-Saharan Africa. So from my perspective, I think that anti-science may stand for the rejection of the mainstream scientific views and method. And as you may know, it's widely recognized and established as a threat for the global security. As colleagues said, as of today, we have 6.1 million deaths reported globally, and I'm sure that anti-science is among the major contributor to that. But the issue is that this phenomena is experienced across the countries and globally, but I can talk of some specificities according to the context. For instance, in Africa, DRC, my country, we have issues with, for instance, charlatan and fake religious experts exploiting the society by promising a cure for all health issues and discouraging the use of Western health concepts and services. Elsewhere, it can be take the color of political gain and all those things. And in Africa also, anti-science, I think has been, I read a comment from one of my colleagues from Lancet. They say that it has been also reinforced in Africa by several reasons, including colonial and other history-related consideration, social media, and so on. So of some of those concerns have been exacerbated by a sentiment expressed from some people in high-income countries. For instance, you remember the two French doctors in early April 2020 with regard to conducting COVID-19 vaccine trial in Africa. Based on my experience, I conducted in 2001 some research assessing COVID-19 vaccine hesitancy in Democratic Republic of Congo. And I was surprised to find that among the factors, the determinant we found associated with the COVID vaccine hesitancy, we found that being a health worker was associated with the decreased willingness for vaccination. And we found also, however, we found that being middle and high income category being tested for COVID and acknowledging the existence of COVID were, however, associated with increased willingness to be vaccinated. And I think the main factor would be the lack of accurate information and on vaccine safety, but also the availability of vaccine. We could use, for instance, the experience from Ebola in DRC in Central and Western Africa to see what has been done at the lower scale to learn more and implement some strategy to tackle this issue. So let me stop there and expect for some discussion, and then we can add more comment. Over.
Great.
Thank you.
Thank you so much. Last but certainly not least, Marco De Luca.
Thank you, Shamers. Thank you, Mel. And hello, everyone. Thank you so much for having me. I was just thinking that it's really humbling to be speaking in front of you all. Thank you so much. What I want to do very quickly now is give a quick sense of the research that I'm doing, who I am, and then talk a bit about anti-science. I'm a PhD student in anthropology and science and technology studies at UC Davis. I've been working on vaccine hesitancy for around 5 years now. Of course, needless to say to you all, even before the COVID pandemic, it had already been described as one of the most dangerous threats to global health that our times are facing. The pandemic has exacerbated the differences between those that support the validity of vaccines and those against it. In the wake of the pandemic across Europe and the US, but really, as we were just saying, across most of the world, the category of vaccine hesitant anti-vaxxer was connected in the media to a lot of qualifiers, idiotic, fanatic, neo-fascists, and so on. Keeping these characterizations present, but also thinking about them as an index of some sort of contrasting attitude, the research that I'm trying to do wants to explore the heterogeneity at the heart of vaccine hesitancy. And if you are interested, then later I can talk about some ethnographic examples that I have. To do so, I am doing an ethnographic studies of a connected group of families. Some of them are based on the west coast of the US, so between Northern California and Oregon. Some others are in the UK, some others are in Eastern Germany, and some others are in the north of Italy. By focusing on how a shared concern towards vaccines links in a continuous conversation very different places and very different people, both online and offline, what I want to do is to describe a network of knowledges, so to say. And what I want to highlight with this expression is how different and context-specific hesitancies at once contribute to and draw from each other. They're informed and inform each other in a way that still does not cohere into a homogeneous movement, and yet at the same time connects them in a conversation that really never ends. By characterizing the pluralism of their experiences, their histories, their arguments, what I want to do is to bring attention to how the complexity of this problem calls for solutions that are imaginative and broad, and transformations in how we deal with socioscientific controversies at large. Getting to anti-science in general, I am thinking with this heterogeneity that I just mentioned to you. And in this perspective, I am not sure whether or not anti-science is a category that, as we have been describing it now, works well or matches accurately the sentiments and the arguments that the people I'm talking with in my ethnographies are exhibiting. In particular, what I'm thinking about is that some people maybe refuse vaccines, not really on the grounds of to think with Dr. Hammond, anything that goes against evidence. Some people maybe they feel connected to the evidence that science provides, but maybe they have suspicion towards other sides of research. Maybe in this perspective, their arguments would be something on the lines of scientific research is a good thing. I trust biomedicine and the knowledge of physicians. What I don't trust is corporate interests. What I don't trust is the whole opaque side, underbelly the knowledge economy that ties together research and big pharma companies. In this perspective, I think that a more capacious, a more broad definition of anti-science has to be able to include not only the distrust of science as we would say in STS, as an epistemic project, so a way of knowing things, and everything that comes from that, but also, most importantly, the distrust of particularistic interests in the way research is funded, administered, and practiced, and so on.
Perfect. Thank you so much, Marco. That really sets us up for our discussion now, which Shama, why don't you take over with some questions?
Yeah, so actually, I'm going to kind of rearrange your questions. Really, what I'm thinking to kind of pull off from what Marco said about the heterogeneity of the problem. I think, we were talking as a moderating group that there's a lot of heterogeneity in the anti-science quote unquote movement. I know it's not the best words to use, but for example, a civil engineer who doesn't get vaccinated because they are afraid of needles, or someone who has a religious exemption or religious problem with it, or an undocumented immigrant who is afraid of getting caught. So really, how does this phenomenon alter how we in public health classify people into these subgroups? Because usually we talk about populations, about race, ethnicity, but this is a much more complex and heterogeneous phenomenon. So what are your thoughts on that?
Do you want to go in order?
We can go, we can start with Dr. Ahmed, if you're available.
I'm sorry, Shama, can you please rephrase your question?
Sure. So really, how in public health do we approach a problem so heterogeneous and complex as anti-science and vaccine hesitancy, given that you can't really use this typical epidemiological issues of race and ethnicity and those types of things to understand the problem, that it's much more nuanced than that?
Yes, I think it's the nature of the issue that we are talking about. This is complex, and more important than that, it's so context specific. What is anti-science may not be so in another place, okay? And that's why, we have to consider all these things. And based upon that, the other things that we have can be solved by, well-designed questions, well-designed studies. But this is something that you cannot. What you have to do is to rely again on very solid evidence. For instance, in the case of Bangladesh, what we do is to have good studies, and then we disseminate the results of the studies. And this is how we can convince public, okay? The civil society is very important. When you want to tackle anti-science, you have to consider which segments of the population you have to first address, and how can those segments of the population help you in driving the message across the population.
Great. Dr. Larson, Dr. Hotez, any comments?
I'll just say, clearly there is a lot of heterogeneity in anti-science, and especially in the anti-vaccine movement. And of course, Heidi and the Vaccines Confidence Project over the years has shown that there are multiple different flavors or types of anti-vaccine sentiments spread across the world. But in my opening remarks, I was referring to something very specific that has emerged in the United States, which is this link to far-right extremism that is now reaches the highest levels of the US government. It's endorsed by about half a dozen members of the House of Representatives and the US Senate. It's played out nightly on Fox News. It's carefully cultivated a cadre of pseudo-intellectuals or contrarian intellectuals that operate out of conservative think tanks. And it is pernicious. It is, and it is focusing on, especially on specific parts of the country, particularly in states where I am in Texas, which is probably the epicenter of it. So I feel it more acutely than most. And across the southern states and up in the Mountain West. And when you talk to individuals who refuse to get vaccinated, that belongs to those kinds of leanings. It's interesting. They will often cite specific reasons why they won't get vaccinated, and they range from everything that sounds reasonable. That vaccines were rushed. How could they be safe because they went through the process so fast? Even though you can debunk that, it still sounds reasonable, all the way to the crazy stuff, right? That there's magnets or graphene in the vaccine. But you realize after a while talking to them that the reasons they provide have actually very little, if anything, to do with the reasons they're not getting vaccinated. They're not getting vaccinated because of a sense of belonging to this group that has these far-right members of Congress as their leaders, that tune into Tucker Carlson and Laura Ingraham night after night, or connected to Breitbart, and it's as, by the way, as academics, it's very tough for us to talk about, because all of our training says you're not supposed to talk about Republicans and Democrats and liberals and conservatives. We're supposed to be beyond that, right, or above that. But and this is the toughest set of conversations I've ever had to have, is that it's not that I'm politicizing vaccines. They are, and our job, if we want to save lives, is to figure out a way to uncouple this I even call it anti-science aggression out of the Republican Party, at least this element of it. And sure, everyone is entitled to their views, and even conservative views, maybe even extremist conservative views, but don't adopt this one. Somehow we've got to figure out a way to uncouple it, because so many people are losing lives. And now, confirmatory data from the Kaiser Family Foundation, from the Pew Research Center, from Charles Gaba, who's a health data analysis from the New York Times, National Public Radio, all point to this phenomenon of red COVID, where the more conservative the county, the more Trump voters in the county, the higher the rate of people not getting vaccinated and the higher the rate of death. And there are confounders about rural versus urban and a few other things, but overwhelmingly this is the problem. And how you fix it is something that it's not, I don't even think it's something that the health sector can necessarily address. This goes beyond the health sector. And you see, for instance, Vivek Murthy, the Surgeon General, trying to grapple with it. And since the Biden administrations have a very tough time getting their arms around it, and rather than wade into that territory, what they do is they go after the social media companies, Facebooks and others. Sure, they're disseminating a lot of this stuff, but they're not generating the content, and we know who's generating the content.
I'm curious to hear from John Titikamena from a non-US context and perspective. You're muted.
Thank you very much. Can you hear me?
Yes.
Yeah, thank you very much. This is a very complex issue, and I think to mitigate this, it will require a work and an interdisciplinary approach. And in the context of Africa and my country, in Central Africa and Sub-Saharan Africa, we should think of the low level of education, for instance, low income, but also linking to that the issue of DEI, diversity, equity, and inclusion, because people with the low income don't have good resources for different needs, and you can find people just involved in different movement, while for different reasons. It can be even for political, but also for the just gain some resources for that. And this has been exacerbated by the social media and people thinking that they don't have a lot to do, but they don't understand what is there if they don't have any good level of education, and even also the fact that we don't in some area we don't have you don't have the availability of vaccines, for instance, to trickle that to help leadership and other influential people to be involved in that and trickle that to the community level for the involvement. That would be really helpful. So in summary, I can say that there is a need for interdisciplinary approach involving anthropologists, social experts, and all those people to understand first the culture and also the social determinant of the issue, and that could help to tackle this anti-science issue. Over.
That's great. I think we are going to take some audience questions because they have some great questions. So Caitlin or Melissa,
Sure.
anyone's that.
Okay, we have a question. What do you think is a better term than anti-science to convey the many issues, not only distrust of scientific authority, but also the entanglements of science and corporate interests and political interests as well. What might be an appropriate term for this phenomenon? You do like a lightning round for each of the panelists.
It's Heidi here. I don't have a problem with the term anti-science. I think the problem is we slap it on to everything from religious beliefs to fear of needles to the far right extremists. Mm-hmm. And I mean, I'm much more comfortable with the term anti-science in the category that Peter, for instance, is talking about. And it's not just a US phenomena. We have similar, although it doesn't have the same it is a type of political polarization, but interestingly, we've got both the far right and the far left. We've got the kind of green naturopathy side, and then, the more far right, as it were. But the other aspect about this group that particularly Peter's been referring to, and this is also true in some settings in Africa that we saw in Ebola, it's become this whole phenomena, and globally, I don't know when we've seen a point in history where healthcare workers have been so abused, aggressed upon, killed in their line of work trying to help people because of beliefs, because of ideologies, because of, we had over 100 polio workers killed in Pakistan. And that wasn't because they were against the polio vaccine. They were about the whole program, the whole, perceived Western imposition. But women died trying to vaccinate. And I'm hopeful, but a little concerned about the new cohort of women going out to do door-to-door COVID vaccination. Power to them, and I hope it works, but I hope they also have some protection, because I do think we have to be very specific with how we use it, because it does have a very specific and very aggressed kind of context. And I think that's our problem.
Marco, would you like to jump in?
Yeah, I can't think of another word. It's a difficult question. What I am mostly concerned with is, as I said earlier, and as both Dr. Hurtis and Larson have been saying, we have to be very careful about lumping this into one thing. And I think Dr. Larson, you worked on that huge project that provided the context-specific definition. I think it's the SAGE working group, no?
Yeah.
And
we didn't touch this issue. We didn't touch the extreme anti. We didn't use the word anti. I think everyone was too, we're not going to go there because it's just on you know, not everyone. I felt I was like a bit of a lone voice and feeling like we need to tackle the elephant in the room, or gorilla or whatever you call them. But anyway, yeah.
Sorry.
Go ahead.
I remember that the definition that that working group provided was sensitive to context specificity. So there was a degree of opening towards, maybe if we don't want to say heterogeneity, pluralism, at least.
Yeah.
The thing, though, is that it's very different. I think that that definition ought to be translated a little bit into practice, because it's very easy to provide neat and tidy guidelines for health practitioners on what to do in front of vaccine hesitants. But every one of those vaccine hesitants thinks differently, as that definition highlights. And so I'm not sure if that's an easy or an effective way forward. But I have a question, just a clarification to ask to Dr. Hotez, just to make sure that I'm understanding when you're speaking from correctly. What I wanted to ask you is, if I understand you correctly when you say that the same, you said flavor of vaccine hesitancy that you were talking about now, so this whole connection with right-wing politics and Fox News, and I mean now Joe Rogan and so on, which you're right is super pernicious, very dangerous. But am I understanding you correctly in that it's not all?
Yeah, that's right. I mean, so for instance, if you go back to Heidi, it's funny talking about Heidi's work when Heidi's right here. So, but if you look at Heidi's, papers looking at the anti-vaccine movement in France, it has its own unique aspects. And there increasingly now in Western Europe, there is more of this kind of far-right authoritarian flavor to the anti-vaccine movement, but it wasn't always the case. And certainly, which especially when you look in low and middle income countries, it has different aspects. I think in terms of the term anti-science, even that now is being weaponized by the anti-science people, because especially the contrarian intellectuals from the far right think tanks, even some university professors, what they will say is the science isn't settled, and just by they'll accuse people like myself of saying, well, the science can only be one thing, and therefore I'm squashing scientific inquiry. And in fact, what they're really doing is they're taking various facts and factoids, that many which are actually true, and then they'll string it together to weave a false narrative in terms of what's happening around vaccines and vaccine safety. But even the term anti-science has become weaponized in many ways. And so if we could find another term for it, it's probably be a good thing. I just, like Heidi says, I haven't really been able to think of anything specific.
One final question, because we are a little bit over time already, but I'll direct this to Dr. Ahmed and John Ditikemina, but what questions or objections to vaccination have you heard that ended up being important for how you chose to approach your research? For example, by shining light on a consideration that you had previously neglected.
So, Melissa, is it particularly directed to COVID-19 vaccine or to any other vaccine?
No, in general.
In general. In the past, and I'm talking about, several decades ago, when the country went through rounds of vaccines against smallpox, there's a lot of anti-science. People started to think that the government is promoting these vaccines as a measure to control population. So the vaccine was tagged with population control. So that was great anti-science. But as I mentioned in my introductory remarks, that Bangladesh is a country where people, they have a liking for vaccines, particularly the ones that are included in the EPI, because they have found that vaccines save lives of their children. As a result of that, the the hesitancy, the stigma, the dogma against vaccines has come down drastically. We don't see that. Even with vaccine against COVID-19, initially there was some hesitancy, but when people realized that this is a very good vaccine, saves life, they have started taking it. So again, it's a poor country. It's a country where, illiteracy is there. But I think the realization among the general public is also there. And this is how evidence and the dissemination of the evidence, the role of the civil society, the media is so very important. And I think this is in stark contrast with what we are seeing in many developed countries against masks, against COVID-19 vaccines.
Thank you so
I'll
much.
stop here. Thank you.
Thank you. And let me just give the final word to John. We have about a minute, so you'll have to I apologize. But it's easy to say that, oh, people were anti-science or vaccine oppositional. They're irrational, and we need to give them the right information and so that they act according to the way we want them to. But if we just suspend that judgment for a moment, what have you learned from people who have expressed opposition or hesitancy that has allowed you to practice your vocation more carefully and responsibly?
Yeah. So just to be in interest of the time, I heard a lot of things, people talking also about the population control of the population, and the other lacking trust in the vaccines in terms of, and I saw some result, people saying that someone health workers saying that there were no sufficient trials to confirm this vaccine that can be used in the population, but also people coming with the rumors from social media, and social media played a very, very important role here. So my standpoint would be, for instance, to prioritize, put a strategy, targeted strategy for healthcare workers, specific strategy for those who are at risk. And if we get more people and we can get a kind of critical mass that can help, those can become also the people that can help to sensitize others and trickle the approach to the community. So in the answer of time, let me stop there and over. Thank you.
Thank you so much, everyone. There are several questions from the audience that I have recorded. We can send them to our panelists. We can also save them for the breakout sessions so that they will be addressed at a later date. Thank you so much to our panelists for this panel on vaccine hesitancy and trust or distrust of public health for joining us today. We're going to take a 5-minute break before we begin with our next panel. Everyone, you're welcome to stick around. We'll move people into the waiting room, I think, so that we can get our next panelist set up with tech support. And we will reconvene in 5 minutes. So at 10:08 p.m. Pacific time. Thank you, everyone.
AM, I hope. Thanks.
Or AM, right?
Thanks. Bye. Thanks,
Bye-bye.
everyone. Bye.
Thank you.
Thank you.
Thank you.
Okay. Kevin at Convex, if you're there, would you mind letting everyone join the waiting room, please?
Sure, I'll do that now.
Thank you.
And we want our next panelist in, so I'm gonna get some of them out. Automatically come back in because of their.
I just got the video on.
Great.
Hi, Amit. Thanks for joining. Can you just clarify, is it pronounced Amit Prasad?
Yeah, that's absolutely fine. Thanks.
Okay, great. And welcome, Maureen.
Are you?
Is
Mine
it,
should be a bit easier.
is it Lichveld?
It is Lichtveld.
Lichveld. That'll be tough for me.
German, the German.
And yeah, we have Janelle Jett as well. And then, hi Janelle, thanks for joining. I think we're just looking for Rory to be in here. So Marina, sorry for any confusion. It's just the 5 minutes for the intro, and then it's
Yep.
really focused on the
The
discussion.
discussion, yeah, no, but there is a perfect presentation ready for the next time, and I will draw from it for today. So I'm totally fine, not a problem.
Let me just make sure. Let's try to move Rory back in here. Oh, he's here. Hi, Rory.
Hey everyone, how's it going?
Okay, good. Okay, so we have everyone here. We're going to start at 10:08 Pacific time. We'll start with just the 5-minute introductions. You'll all go through and introduce yourself. You'll sort of just frame, how you think of anti-science, how you approach it in your work, and what your research sort of in this area is about. So it's really meant to be an introduction into our panel, which is panel discussion, which is the main focus. So I will feel terrible doing it, but I'm going to interrupt you at 4 minutes and say you have 1 minute left during your 5-minute introduction.
Yeah, because we really do have a lot of really interesting discussion questions that, and it's important for you to introduce yourselves and your work, and that's very undeniably interesting, but really we want to make sure there's enough time for this discussion, as well as to facilitate questions from the audience. So we want to place the emphasis there, if that's okay with you.
And I know a few of you might be using slides for your introduction. Amit, you're one of them. Did you want to just test your share screen right now?
I could do that. Like the quick question, I've timed it in 5 minutes, but at the same time, the broader idea is a good one. The reason I wanted to sort the slides because I thought it would facilitate the discussion. So let me share and see if it works, and then, okay, it may not work. Because what happens is that, oh, okay. Okay, let me see if it works.
But I'm a bit confused. So are we allowed to use slides then for the 5-minute introduction?
You are, yeah, you are.
Okay.
Yeah.
Yeah,
So,
you're welcome, but you don't have to. And
I'll just let it be, because what happens is our Georgia Tech, like for example, like they had this issues with Zoom, so they just make it restrictive. So I am finding it a little difficult to share, and it might just add an extra minute with the other way or something. I did share with Melissa even my the presentation, so we could but at the same time, it does not make much of a difference.
Okay. Rory, what's your preference? Do you want to try to share yours and see?
Honestly, I can use it as a prompt, but I don't need to share it.
Okay,
like
let's not, and then
let's keep it simple. No one in the other panels use slides. We can have it this way, no one slides, and then that way we can just get to the discussion. Okay, so does anyone have a preference on order? We have 1 minute before we invite everyone back into the room.
I had just sent, it alphabetically. So
okay.
If that's okay with everyone, it would be Janelle, Maureen, Amit, and then Rory.
All right, let's get people back in then, since we're a little bit over time anyway. Kevin, would you mind admitting everyone back into the room? Kevin at Confex. You're muted, Sean. Okay.
Okay, I think we're all set to start up again. Thanks everyone for joining the second part of our satellite session. This is titled Discussing Anti-Science Through a Transdisciplinary Research Lens. I'm Caitlin Cilio. I am an assistant professor in public health at the University of Texas in San Antonio, and I'm also a research committee member for CUGH. So I'm pleased to be here to moderate this next session with our 4 expert panelists. The goal of this panel is to showcase a broad range of paradigms and methodologies used to understand and intervene on anti-science. We've selected panelists from a range of disciplines and backgrounds as a way to promote thought and discussion on transdisciplinary research and intervention approaches. So to start off, I'm going to give each of our panelists 5 minutes to briefly introduce themselves, how they conceptualize this phenomenon of anti-science and the research in this area. And then after the brief introductions, I'm going to guide the group in a 15-minute moderated discussion, and then we'll conclude with an additional 10 minutes of Q&A from our audience. So please use the chat function to write your questions for the panelists throughout. So like I said, 5 minutes, I'll give everyone a 1-minute warning. Let's start with Janelle Jett from Purdue University.
Hello, and thank you so much. So like she just announced, my name is Janelle Jett, and I'm a Sloan Foundation postdoctoral research scholar with the New Carbon Economy Consortium. And I currently conduct research through the Center for the Environment and the Social Cognition of Social Justice Lab at Purdue University. So my training is as a political scientist, and my work really sits at the intersection between political science and psychology. And in particular, I specialize in political communication, particularly in the context of science, technology, and environmental policy. So in my work, I've examined the ways in which right-wing populist messaging promotes skepticism towards climate change. And right-wing populist rhetoric is this big growing concern, both as a virus of democracy and as a limiter of support for vital policy action. So populism, just so we're kind of all on the same page, is really minimally defined as a set of ideas encompassing an antagonistic relationship between the people and the elites. So at its core, populism is driven by hostility towards elites called anti-elitism, and this anti-elitism is closely related to anti-intellectualism, or a generalized suspicion and distrust of intellectuals and experts of sort of whatever kind. And I start this not talking about anti-science, but really with this discussion of anti-intellectualism and anti-elitism, because my work really doesn't look directly at anti-science in ways that divorces scientific attitudes from the trust we place in scientists themselves. And I think this is actually a pretty nice transition from the last panel. So turning back to this idea of populist communication, I examined in my work conservative media coverage of climate change in the US, and I found that the most common ways populist messages promote skepticism towards climate change is not to criticize the science, but to attack the scientist, right? So in my findings, close to 70% of populist messages use skeptic claims attacking policy and scientific processes rather than evidence that climate change exists or that it's anthropogenic. And this comprises messages that climate change is a hoax perpetuated by scientists for fame, that political processes are interfering with science, and that the media is sensationalizing climate change science and distorting public opinion. So one example is a presenter in Fox News in 2017 described scientists laughing in their lavish laboratories and spending taxpayer money pretending they can predict the future. And really my argument here is that these anti-intellectual and anti-elite attacks are extremely consequential, because even as scientific evidence grows on a given issue, if we don't trust scientists to report their findings honestly, or politicians to act in good faith to address the identified problems, this furthers policy inaction on many critical issues, like climate change, which I've looked at, but also massive issues in public health and beyond. And so really turning to how this work connects to the concept of anti-science, I want to reemphasize that my work really centers on that trust relationship, or the lack of trust, between those that identify as the public and those they perceive as being part of the elite or ruling class, which in today's politics often includes scientists. And from that point of view, then, and from my perspective, then, anti-science attitudes follow, at least in part, from failures of that trust relationship, political motivations, or perceptions that scientists and the public lack common interests. And while I look at climate change right now, from the political science view, there are many commonalities between climate change and public health challenges that require individuals to make individual changes and politics and politicians to act under conditions of extreme partisanship, scientific misinformation, and anti-science attitudes.
1 minute warning.
So perfect. So I was about to turn it over. So from that, I just really want to close and say that I'm really looking forward to this panel and all the different disciplinary insights into this important topic. So thank you so much.
Thanks so much, Janelle. Let's move on to Maureen.
Good afternoon for the Eastern Coast here. I'm Maureen Lichtveld. I'm the Dean of the School of Public Health at the University of Pittsburgh in Pennsylvania. I'm also the professor in environmental health and the Jonas Salk Professor in population health. I'm here because I admire Melissa and all what she does and her leadership. But what I bring to this panel is indeed a transdisciplinary view of what I actually call more mistrust in science. And in my field of environmental health, including climate and health, we encounter that not as a new phenomenon. Yes, COVID really brought things up now, but that isn't it. So from a public health perspective, we always connect science and policy, and in turn, policy and practice. So how the relationship among those three domains influence what happens with science is critical. Delays in science, for example, influence how policies develop, and as in not being science-based, and policy not based in science influences what happens on frontline practice. And so when we look at science mistrust, there are three dimensions of the infodemic, so to speak. Susceptibility, why are some people more and other people not as susceptible? How are things spread? How is the information spread and what channels are being used? And how do we become more psychologically immune to the mistrust that is there? How is trust being seen and how is trust used? And how do we deal, and particularly with COVID, with the social uncertainty that actually fuels this mistrust for science? And so there are a number of strategies to go around, also ways to, instead of debunking information, that's where I will end, pre-bunking misinformation. So how do we do that together? And I think the world and public health as a transdisciplinary phenomenon and approach in our world is critical. The last thing I would say is, and that was a reminder from the first panel, is that we shouldn't forget that this is a US phenomenon, this is a global phenomenon, and I hope that in the discussion we'll go more into it. Thank you.
Thank you so much. Amit?
Hello all. I'm an associate professor of sociology at Georgia Institute of Technology, and I study global and transnational aspects of biomedical inventions. I did a study of MRI, and for the last decade or so, I've been studying a particular clinic in Delhi where patients from literally all over the world have been traveling to get therapy for the last decade or so for a variety of conditions. The question for me has been that how do information for which there is not enough scientific evidence, how do they travel? How do people get to it? And two, how is it interpreted by the people who use them? So when the pandemic started and the whole thing just proliferated in 2020 itself, I started studying this thing about the misinformation and conspiracies in regard to COVID. And before I just read out something, because I want to lay out the issue much more specifically here, I want to say here that the problem is much, much bigger. It's not simply misinformation or conspiracies with regard to science. We need to have centers or programs to study misinformation because it's our democracy and citizenship which is at stake now. It's like a very dramatic change going on. Let me just read it in that context. So this is a quote. Judy Mikovits, PhD, spent 20 years at the National Cancer Institute working with Dr. Frank Ruscetti, one of the founding fathers of human retrovirology, and has co-authored more than 40 scientific papers. She co-founded and directed the first neuroimmune disease institute using a systems biology approach in 2006, end of quote. This is a quote about the author's short bio on Amazon of a book that she wrote called Plague of like Misinformation or something. Judy Mikovits, for those of you who may have missed it, is the person whose interview in the conspiracy video titled Pandemic had gone viral in May 2020 at the peak of the pandemic in the US. The video was banned from various social media sites very soon. However, you can still find it because it keeps mutating. The conspiracy video, in which Mikovits presents various conspiracies, including why we should not get vaccinated, also started with laying out scientific credentials of Mikovits. The video does not mention that her paper published in Science, which she proudly discusses in the video, was discredited. Now, we can argue that she's using science for her anti-science claims, and that indeed is true. However, minimally, this should force us to ask, why have anti-science propagandists been using science's credibility? Quite simply, why don't they just call themselves anti-science? I had started studying various COVID misinformation conspiracies, as I said, in April 2020, when most of them were still circulating freely on social media. And I have not found a single COVID conspiracy theorist or misinformation spreader call himself or themselves anti-science. In fact, in May 2020, when not only the pandemic, but also misinformation and conspiracies were raging in the United States, a survey conducted by the Consortium for Public Understanding of Policy Preferences across states found that both Democrats and Republicans, they trusted scientists and doctors to handle the pandemic more than they trusted Congress, President Trump, state government, and even CDC. Now, let's be careful here that this also varied, as Heidi pointed out, over time. Now, let me state plainly, I agree with many of the studies that have shown the various impact that COVID has had, but we need to fine tune our strategy because otherwise we are not going to be able to handle it. First and foremost, we have to understand that the overarching and reified idea of science, the way we use it at this present time, it emerged during the first half of the 20th century, just around post-World War I, to reckon with the violence and misery of that time. And it has outlived the utility, particularly if we take into account how it is being used to support conspiracy theories. I can keep rattling various examples as such on this.
1 minute warning.
Sure. A retuning of our strategy, as I'm suggesting, forces us to look into underlying factors more carefully. To start with, we'll have to more carefully understand the mechanics of how the information spread. For example, the virality of information gave credibility to the information. And there is also this idea like how quickly it can travel, like from China to Africa to this, that also we need to take care of. The other aspect, which is very, very important for us to understand, is that even when the information is wrong, the interpretation of misinformation can tell us a lot. And what I found was, for example, with a specific conspiracy with regard to Bill Gates trying to control with the vaccines, the interpretation that was given to the particular conspiracy in the Black community as opposed to the white community was quite different. And I can read out quotes when we need to discuss further. But the broader point here that I'm making is precisely this, that we need to get into it much deeper if we need to handle it. Thanks.
Thank you so much. Okay, our final panelist introduction, Rory.
Yeah, hey everyone, it's great to be here. My name is Rory Smith and I'm the research manager at First Draft. For those of you who are not familiar with First Draft, we are a nonprofit that specializes in kind of all issues related to information disorder, including misinformation and disinformation. So when it comes to how we understand the anti-science trend, well, it's not a monolith movement, and I hopped on the last panel at the very end, but I'm thankful to Heidi for having brought this up. You know, people obviously have different reasons for believing what they do, and treating the anti-science trend as one entity leaves essentially no room for nuance and little room to understand why people might be mistrustful of science or vaccines, etc., which ultimately makes it all the more difficult to design effective interventions to mitigate this skepticism, right? And we saw this with terms like anti-vaxxer. It isn't one monolith population, and kind of applying these reductionist terms isn't helpful at all to researchers, to policymakers, to people essentially, you know, trying to intervene to undo this kind of widespread mistrust right now. And we ultimately see the kind of this skepticism in certain scientific things as a product of political polarization, of kind of collective sense making during crisis situations, notably the pandemic. New technologies, including social media, very low levels of media literacy, little platform in tech accountability, and outmoded communication strategies and irresponsible reporting. So unfortunately, it is transdisciplinary. There isn't one particular issue that is facilitating the spread or expediting the spread of skepticism around science, but it is very much multifaceted. And where does our work fit in? So what we do is essentially research primarily into data deficits. And what I mean by data deficits is where kind of the supply or the demand for information and kind of reliable and trustworthy information is high, but the supply for that particular information is low. And essentially where data deficits exist, they provide space for rumor, misinformation, misleading facts, et cetera, to surface, which can then be capitalized on by opportunistic politicians, bad actors, et cetera. And so I'm glad Maureen mentioned this, but a lot of what our work involves is figuring out the best way of getting ahead of misinformation, which involves primarily designing good pre-bunking strategies. And we found that identifying data deficits early on is one of the most effective ways of building content that's used to design pre-bunking, essentially, kind of mitigation strategies. We also have kind of refocused our work around understanding narratives, right? So individual pieces of content, while they were kind of the focus of a lot of fact-checking organizations and still are, we found that they, by and of themselves, aren't necessarily what change people's minds. These individual pieces of content essentially contribute to broader overarching narratives that ultimately affect how people make decisions. And for our work and our purpose, it's much more expedient to go about narratives rather than individual pieces of content, right? Because in the end, you end up just playing a gigantic whack-a-mole game, which isn't helpful for anyone. And ultimately, what's really important is engaging with the public and communities, right? I think by applying these very kind of broad labels, such as anti-science or anti-vaxxer, we forget that these are actual people, right? That they have their own experiences and their beliefs, their beliefs are often sculpted by them trying to make sense of this world, which is very much overcomplicated. Where we're faced with kind of a superabundance of information on a day-to-day basis. So where do people look for information? What kinds of content are they exposed to? What are they searching for? What essentially is an information consumer's journey look like? What does it look like? And it's important that we don't forget about this demand side understanding, as that's the most important part when designing effective interventions. So that's it for me.
Okay, thank you so much. So we'll get right into our moderated discussion. We have 15 minutes and I have a set of questions that I'm going to use to guide us. After the 15 minutes, we'll be taking Q&A from the audience, so please use the chat function for that. Just to start us off, I think, Rory, you sort of went into, from your perspective and from First Draft News's perspective, sort of what are the root causes of the skepticism today. So I'd like to just kind of have a little lightning round of our four panelists comment on what we think the root causes are in this phenomenon, currently. And maybe, we've also talked about already that this is really not a new phenomenon. So what is new about it and what's not new about anti-science? Rory, if you want to maybe start and expand on, what you've already discussed.
Yeah. Well, I discussed it in brief. Like those are some of the factors among others that are contributing or really kind of expediting this trend towards skepticism in science, right? And I'd add on top of that we also kind of exist in this kind of grifter economy where people are willing to sell, to monetize falsehoods. And that can be done either like politically, with political capital, or, for actual monetary gains, right? So unfortunately, it just makes it difficult to point the finger at one particular factor. But we also see, technology is expanding exponentially, and lots of people just don't have the tools or equipped to deal with it. And we're in this kind of stage, this Wild West stage right now, where ultimately people are very much trying to make sense of the world around them, but they're also dealing with the superabundance of information, and most of the content out there is junk. I mean, the internet is great, but the internet has also democratized really bad information, right? So there's no meritocracy on the internet. And I'd say that that's one of the biggest issues that we all face today, and that contributes to this type of skepticism.
Thanks, Rory. Does anyone want to add to that?
Yes, let me jump in and say that we are ignoring, there are really 5 reasons why. One, we're ignoring the evidence base about misinformation. And so we're ignoring, for example, that in order to debunk or pre-bunk a myth, we need to make sure that the correction that we're trying to get through is connected and well connected to that myth. We can't talk about B and really it's about Z. Secondly, we need to know that there are both cognitive drivers and socio-affective drivers that ultimately lead to false beliefs. We need to know that 3 types of information there are to counter misinformation are not only fact-based and logic-based, but they're also source-based. And often we ignore the source as a way to counter information. So ultimately, the evidence base is critical to develop effective interventions. Secondly, we need to facilitate the transparency at the earliest possible time. And so it's okay to say at some point in time, we don't know that yet. And physicians specifically have a tough time doing that. I'm speaking as a physician. We need to provide greater access to scientific evidence. And so not keeping it with us, but making it translatable and in a transparent way for people to have. We need to promote, and we talked about that, I think Janelle talked a bit about that, is promote science and health literacy. Otherwise, we're just talking to ourselves in tongues that very few people understand. And lastly, critically important, we need to integrate the science of misinformation into educational competencies in all health professions education.
Thank you. Janelle or Amit, anything to add?
Yeah, I would actually sorry. I'd actually love, I feel like what I have to say directly follows what Maureen just said, and I want to co-sign on everything she just said. It's being brilliantly put, but I think also considering the role of values is really important when we're talking about science information and how we communicate that effectively with the public. And that in a lot of cases, when people are making decisions, facts aren't always enough to make a decision on what to do with that information. And when we only present things as sort of dry facts, it opens people up to interpret them how they choose and modulate those in ways that sort of distort those facts into a different reality, right? And so I think that a lot of the root causes of anti-science right now is really a disconnect between the science and the value structures that people have and how they interpret that science and apply it to issues, right? So just saying it's a fact that climate change exists doesn't mean that the government ought to do anything about it, and that facts alone can't answer that ought question.
Yeah, Amit?
What I would just say, add to this, and I agree with what has been said here, is that one aspect we have to realize it's conjunctural and it is happening at a much broader scale. So for example, if you look at like former President Trump would directly address the social media, would not even have press conferences. And this is being done by various heads of state. So what is happening is the way democracy, in the sense of knowledge, not just distribution, but engagement was taking place, is changing very dramatically. And so we need to understand that there's a broader change. Just making information available is not going to help. And it's not just a question of sorting out. The second part we have to see very, very carefully here is that yes, all of this is important that, okay, these are the factors which are causing it and all, but we need to go more carefully and find different answers. So I'll give you an example. With stem cell therapy, they did a study in Canada. They provided that, that if they knew that these were not really scientifically proven, would they still try? And most of the people who are healthy individuals, they said they're still going to try. The point I'm saying here is the fact that even after we made so much information available in the last 1 year, a significant percentage continue to grow or stay in terms of anti-vaccine or whatever. So the point becomes, what is the strategic node? So if when we go to the interpretation part of, rather than just doing what is factually incorrect, we go to, it allows us to see or show that through which nodes are they connecting. Because information does not travel as facts, it travels as representations. And representations tie these things. And that is where our targets will be, and it will be moving targets. And this is not something which is going to go away. It's true, we can try preemptively or something like this, but we'll have to learn to live with it, just the way it is with virus. Thanks.
Thank you. So we did start to talk about some evidence-based strategies. We talked about debunking as one strategy, and Maureen listed a few other strategies. So I'm wanting to get a little bit more into that, and from your perspective and from your own research, what has worked for you in researching and addressing anti-science or attitudes, communication, and what have we learned from research so far that works in terms of going forward?
There is an interesting comment in the chat, or a question on alternative science. And alternative science begins to be created if we don't listen, if we don't connect with our target audience. And one example I can give you in the world of environmental health, and in the world of, but in this case, cancer, specifically, and the relationship between exposure to environmental toxicants and cancer, is that breast cancer can exist when you drink specific contaminated water, or breast cancer can, but at the same time, breast cancer can also occur after you go to a mammogram when your breasts become like a pancake. Or breast cancer can exist when you wear too tight of a bra, or work in PFAS in environmental health. There's a lag time between what we know about all of the research that's going on with the intervention that communities are asking for. So listening and connecting with your target audience so that you can tailor what you are, what they're interested in, not what you know, I think is critically important.
Want to add to that? Otherwise, I'd like to maybe talk a little bit about what stakeholders need to be involved in the research process, and sort of more broadly trying to address the issue.
The only thing I would just like to add here, and this came out also with regard to following the stem cell research for the last decade or so, I get this point that that if the information needs to be disseminated really, really well, but we would also need to learn to listen much more carefully to those people who are supposed to be anti-science. Because what is ending up happening is we are sort of recreating exactly the straw man, what they are calling it to be. And so when we just say that, oh, information is not coming and that's why you're looking for this alternative or something like that, you're just ending up recreating exactly what is happening. And the very fact that it has not worked should give us at least a pause and to take us further, in the sense of the fact that what is happening here is that for example, many of these in the non-Western world in particular travel through WhatsApp, the misinformation and all. And who was the one sending it became a very important part of the credibility. So what I again would say to you here is that it is not an easy, straightforward solution. Yes, we'll have to increase the package. And I think I'm glad that you people called for a transdisciplinary research. And this would call for a self-reflexive questioning for the medical scientists as well as scientists. I can keep giving you so many examples where how medical science and medical scientists were used in these conspiracies as well.
Yeah, I'll add in there as well. When I talk about data deficits, that's kind of the one of the main strands we focus on. But a core part of that is you can monitor social media, you can look at all this content online, but if you don't understand your audiences, if you don't understand the communities and what they're also searching for, all this is moot, right? So there needs to be a lot more outreach at the community level. And we've talked a bit how anti-science as a term is unhelpful. And it's unhelpful because, again, like I said, it's hard to provide any nuance on what communities make this up, but even there are communities within the communities, right? So, we've done a bunch of research on how kind of vaccines or I guess skepticism around vaccines is interpreted by different communities in the US, and there are very different ways, between Latino and Black communities. It's not the same. And I guess issues and concerns are always going to be different, and it's important to understand where people are getting their information from, what their concerns are, and ultimately without this, it just makes research, interventions, etc., next to impossible.
Rory, so before we move on to the audience Q&A, let me just ask a final question. I'll pose it to Janelle to start. What do you think is the most pressing research need on anti-science right now, particularly in relation to global health?
I think sorry, was that to Rory or was that to me?
No, it was to you, but.
Yeah, I think the sort of obvious answer, and so I'll start with this, is that, and I think what everyone on this panel has been discussing are solutions, right? So how do we address what already exists, and how do we prevent the same mistakes from occurring as we enter new arenas, right? So I've talked a lot about climate change, and I think that COVID's obviously on people's mind when we talk about anti-science today, but this isn't certainly the last time this will come up. And so what have we learned from the issues we've dealt with in the past? What do we know more now? And how do we sort of successfully apply those things to the next moment? Especially, I think so much is talked about pre-bunking and things that we can do to address sort of information before we sort of have entered this sort of balkanized conspiratorial space. And I think also sort of reviewing that, also taking a step back and saying, okay, what can we do in environments that have already become, ultra politicized, very, very difficult to communicate with, and how are those two things different, right? I think the ways we can talk about COVID or climate change are very different than the ways we can talk about, unfortunately, the next, public health concern or areas that aren't highly politicized, and that those require very different types of communication and nuance in ways that are very challenging, but I think we end up restoring those sorts of relationships that we really want to have, where we recognize all the reasons people might have distrust, we recognize reasons people might have concerns, and or not be initially receptive to information, and how we can then improve that information and take it forward, right, I would say.
Thank you. Melissa, did you pull some questions from the chat that you want to start to pose?
Yes, great, thank you. Okay, so we have a few comments. I'm gonna try to synthesize them, but a comment that, that we tend to focus on, the general public, and maybe kind of characterize them too broadly and too simplistically as like either information naive, or lacking in the right kinds of information. How do we think about this other facet of the anti-science phenomena that is more deliberate, that is more organized, that no matter what information you throw at them, they may choose to reject it or resist it. And I think that also, just let me just add, so that's part one of the question. The other part being, how do you guys recommend that we disentangle like the really real links between scientific research, industry interests, and political interests that a lot of people who we might call anti-science are worried about or drawing attention to? How do we disentangle those links to respond to some of their concerns?
So let me start by going back to Caitlin's question about who should be the stakeholders. And hearing it from an environmental health scientist for almost 4 decades, you'll be surprised by my following statement. You cannot put your enemy outside of your tent. Meaning, if we consider industry or any political faction as our enemies, and we might put them out of our tent, we will never have victory. We will never be able to get where we want to be. And so truly taking a broader approach to stakeholder engagement will also address some of the elitism question that was in the chat. Secondly, be willing to exercise truly the 3 principles of crisis communication. Be first, and we certainly weren't first with COVID, nor are we with climate. Be right, as close as we can to the science, and be credible. And we just struck out on all 3 fronts. And be credible means, and this is Melissa, where your question is going, means that we step outside of that limelight and have a religious leader lead, have a community leader lead. And so we enable them to get that message out and get the action that we're deciding based on that message, and use the channel that they prefer, not the channel that we prefer, just because we think it's the best channel there is in terms of getting our message out. And so those are some of the tactics and the strategies that we need to be, but it's a lot of humility, a lot of trust building, as we say in disaster management. During a disaster, it's not the time to exchange business cards, although we don't exchange anything anymore, given COVID. But it is that taking time to build that trust over time. Then when there is a crisis, you can work from a trusting relationship rather than creating a new relationship in the moment.
Follow up, Maureen, would you go so far as to say, in public health, and I guess, and Amit, I invite you to respond to this question as well, because it's not just limited to public health, but scientists, research scientists in general, or even, so other so-called elites. And I'm paraphrasing a question from the audience, but when people in privileged positions such as these, either lose credibility, falsify information, or distort it in such a way, are they being anti-scientific?
Unfortunately, there are those among us who deliberately distort information, who deliberately use their position to not only be anti-science, but deliberately influence information that is not, that just they know it's incorrect. We can only counter that by going back to the root causes of those problems, but by empowering those who can see through that and counter that. That's where our world is to interact, and that's where our opportunity is to counter, not by only limiting our interaction to go scientist against scientist, because you will never win a debate for people whose cause of being and cause of existing is to develop that, and even often paid to do so. And so going back to understanding who our target audience is, having a relationship long before you need a target audience to act, is really the premise of public health and the premise of prevention.
Amit, would you like to jump in?
Sure. So what I would just say here is that when I was emphasizing over and over again with regard to listening part, that very often, and I have interviewed a number of scientists, including worked in one of the persons who got the Nobel Prize for MRI, it happens is that it is told that, okay, science is not just about truth, but what ends up happening, and there is this kind of a way it almost goes that, but yes, it can give the truth all the time. what is forgotten in this kind of a process here is that there is this kind of a defensive, aggressive way of approaching many times scientists, medical scientists, all they go about. And they do not emphasize that, oh, it is a situated knowledge. So for example, industry plays a very important role in terms of certain choices that scientists make, and it changes. That doesn't mean that, okay, the truth is not there or things like that. So we will have to accept with the humility part of also with regard to science and medical science. One is that part. Second, which I wish to emphasize, which has been emphasized in the chat here, when I was doing with the stem cell research, I was just struck by how much scientific information the patients had gathered, like various kinds of research papers or things like that, and they were interpreting in their own ways. So we have to understand not only simply the fact that, okay, these are going to be good messengers of what I already know, that what does it force us to rethink or things like that. So I would just want to reshare or re-emphasize this part, that there is an issue, this idealized understanding of science keeps playing out in some way or the other. And that was a particular historical construction, and we have to let go of it.
Fantastic. I have one more question from the audience before we conclude this part and take a 10-minute break. How do we teach the public? Also, I mean, which includes everyone, the difference between quote unquote legitimate scientific disagreement or like healthy forms of skepticism and more, cynical takes. Someone asked, does it boil down to who you trust or who you distrust? Actually, the question was directed to you, Rory. Could you explain the difference between like healthy skepticism and more of like an anti-science kind of cynicism?
Yeah, no, and to somebody's point earlier, I use skepticism of science. I don't mean the skepticism is bad. We should all be skeptical, especially in an information environment that we exist in that's just full of lots of not so great information. But I think it's always important when we talk about debunks and pre-bunking, we need to provide context, and we need to explain that even within the medical community, sometimes, or within the scientific community, that there are debates too. Like truth is constantly debated. And that's how it's always been. New evidence will beget new results, which will overturn, prior studies. And that's part of the process too. So I think really explaining how science works to the public in a way that's understandable and digestible is a really important part of this, and really important to provide transparency, because ultimately people are like, we think of them as like firebrands or crackpots, but most people are pretty decent, and I think we forget about that in today's world.
Janelle, did you have anything else to add? Not to put you on the spot, but you can have the last word if you like it.
Well, always. But I actually want to agree with, I can't tell the person's name in the chat. I think it's Michael Holloway, that they're having some comments I think are really well thought out here. And I really agree with that there are ways to discern in the scientific community, and that educating the media is also a part of that, right? And making sure that we're doing, and I think Rory and Maureen both made comments to this before, that we're doing our part to make sure that our dissemination is solid, so that the media can then correctly interpret that and spread that to the public. Like our reach as scientists is so much smaller than the reach of the networks that are actually connected to the public outside of us. And so if we improve the ways we communicate to those actors that have that reach, I think that we can improve how they're able to then discern good from bad. And I think this has played out in a lot of environments. So in terms of just like bad actors having access to politicians, for instance, and having no real expertise, but knowing how politicians think and giving them the information they want to hear, right? And so if we kind of learn how to talk to politicians or learn how to talk to media, we can help educate them into how to make solid judgments about what is good and bad science too, and helping that sort of chain be more effectively linked.
Thank you guys so much. I loved this conversation. Thank you so much for everyone of our panelists for joining us today. For everyone else in the audience, we are going to take a 8-minute break. It's 10:52 a.m. over here in California, and we will reconvene at 11 o'clock a.m. So in 8 minutes. We'll ask you all to enter the waiting room again so that we can get set up with our moderators for the next session. Any questions that have not been answered, I've saved, and hopefully we can address those in the breakouts, or I can send them to the panelists at a later time.
Just to bring everyone back, we have Peter Spector next. Is that correct, Melissa? From
Michael Spector. Michael Spector.
Sorry. Michael Spector from the New Yorker.
Yeah.
So we're really looking forward to that and hope everyone joins us. Thank you so much to our panelists. This was excellent.
Thank you. Okay, Kevin from Convex. Would you mind facilitating the waiting room, please? Kevin from Convex.
Caitlin and Melissa, you want us to stay on for the rest as well, correct?
It's totally up to you. We were hoping that you all would stay as long as you can. The next 20 minutes will be a talk from Michael Spector, and then we go into breakout sessions. So it would be great if you participated in those breakout sessions. If you can, we'd maybe put you in a moderator role, but we understand time constraints.
Okay, no, I just want to make sure that I am available and I'll just stay on. Good.
Okay, wonderful. Thank you.
Thank you so much.
There's some great one-liners in the chat.
Yeah, we have to make sure we can capture all of that.
Yeah, I saw you did most of it. Did you get the end of it, or do you need me to do it?
I think if you can get the end of it.
Yeah.
Okay, so Kevin, we want to have Jawad and Elizabeth Frost stay in this room and not into the waiting room. We want to make them co-hosts. Hey, Liz. We also want to bring in, okay. Hey, Michael, how are you? Oh. Kevin, can we get Michael Spector in this room, please? Oh, here, and make him a co-host. Hi, Michael, how are you? Yes, how are you doing?
Good. I'm sorry for my MIT background, but my actual office is being painted and it looks like a nightmare.
That's okay. So. We'll get started in about 4 minutes.
How's it gone so far?
So far, so good, I think.
I think it's been great. Yeah.
Yeah.
Great group of people. I'm sorry that I couldn't participate. This is like a crazy week for me. I would have at least liked to hear the panel that Peter was on.
Yeah, well, this will be recorded, so at some point we can get that to you.
Cool.
Do you want to share your screen at all, or will you just be speaking?
I'm just going to speak.
Great, that's great.
Now, I didn't ask this, but is this a forum where people are going to want to ask questions?
It's up to you. They have access to the chat room.
Oh,
we can collate questions if you would like.
I'm totally fine with questions. I mean, I know there are time constraints that you guys have.
We are on schedule, so it depends on how long your talk goes. We have 20 minutes.
Yeah, well, I'm going to try to trim the talk I wrote down
Okay.
because otherwise you would all cry and we'd be to death.
Okay.
We don't want that.
So if you want to, it's up to you. If you, if you would like us to give you a warning or something at the.
No, I can see how
Okay.
long I'm going. I'll just talk for a while and
Okay, and if
in general, the questions are usually better than the speaking, but
right.
So I'm happy to do that.
All right. So then if you want maybe at like 15-minute mark, we can.
Yeah, I'll try to talk for 15 minutes.
Okay.
That's
And then we can do
and then
5.
We can have some time.
Perfect. Before we get started, Kevin, can you hear me real quick? Hey there.
I hear you.
Okay, so this is a little tricky. So we want right now only Michael's video to be on, or we can leave it how it is with the co-hosts have access. But after he finishes speaking, then we're going to move into breakout rooms, and we want to enable the audio visual functions for everyone.
Okay.
But that won't be until after Michael finishes speaking.
And Melissa, do we need to give Kevin instructions on like having the co-hosts all?
Yes. So Kevin, so we are going to have 6 breakout rooms. And I can tell you who will be the moderators of each of those so that you can assign people to us.
Okay, so you want me to assign everybody to separate breakout rooms? Do I have that list? It's going to be in what breakout?
I'll tell you the list. I'll tell you the list of the moderators.
I think he's asking if I think it's just a random assignment. It doesn't have to be, there's no this group has to be in this group. Yeah.
Okay, I understand.
So I'll be in charge of one group. Elizabeth Frost will be in charge of one group. Jawad Noon will be in charge of one group. Caitlin will be in charge of one group. Shama will be in charge of one group, and so will Marco. And it's 11 o'clock, so if everyone's ready, we can invite people back into the room and introduce Michael Spector. So I think I'll go, okay, here we go. Okay, welcome back, everyone. This is part 3 of our satellite session towards a transdisciplinary research agenda on anti-science. It is my real pleasure to introduce our next and final speaker, Michael Spector. He is an acclaimed writer for The New Yorker, an adjunct professor of bioengineering at Stanford University, and a visiting scholar at MIT's Media Lab. Since joining The New Yorker in 1998, he has written about the global AIDS pandemic, avian influenza, malaria, the world's diminishing freshwater resources, new ways to edit DNA with CRISPR, gene drive technologies, and the implications of the COVID-19 pandemic, among many others. In 2010, he received the Committee for Skeptical Inquiry's annual prize in critical thinking for his book, Denialism: How Irrational Thinking Hinders Scientific Progress, Harms the Planet, and Threatens Our Lives. He is also the author of a new audiobook entitled Fauci, wherein he traces Dr. Anthony Fauci's life from his childhood in Brooklyn through his leadership during the AIDS epidemic in the 1980s to today, where the response of the COVID-19 pandemic and the future of viral research are shaping humanity for years to come. We are very, very excited to have him here today to share his thoughts on the problem of anti-science and how to rebuild public trust in science. Thank you, Michael.
Thank you, Melissa. I really appreciate being here. And I'm going to pretty much jump right in because there isn't all that much time. And I want to talk, and I also want to give people a chance to ask questions. And rather than do something that I was going to do, which is talk about vaccines a lot, you've heard some of the best people in the world talk about vaccine hesitancy and opposition to vaccines. So I want to jump in with something that I really wouldn't normally start with, but I think when we talk about anti-science, we have this vision of hardcore zealots. And there are a lot of those, but I think that's not even the biggest problem. Often the lies and the distortion of reality are subtle, and in some ways that worries me more. And I'll give you a couple examples. These days, I'm not sure we know how to think about scientific authorities. And when I say that, let's look at the FDA for a moment. They are the agency that we entrust to protect us against bad medicine and faulty cures. They're really an important agency, and they play an important role in our lives. Well, last year, the FDA approved a drug called Aduhelm. It was the first drug on the market able to remove the sticky plaque in the brains of Alzheimer's patients. A big deal, a really big deal. My father died 12 years ago of Alzheimer's. My mother is in a nursing home with dementia. I care about this a lot, and I know that I'm very far from the only one, probably far from the only one listening now. This was the first new drug approved since 2003. But weirdly, every single FDA advisor rejected it as useless. Not most of them, not some of them, not bitter debate, all of them. A couple of them quit the committee. They said such things as approving this would be a disaster. But the FDA didn't seem to care, and they did approve this drug. They wanted to win, even if it was only cosmetic, because it's been so long since we've had some good news on Alzheimer's. I understand that as a human emotion, but I don't understand it in any other way. So then what happened? Well, leading hospitals decided, we're not going to administer this drug. And I was thrilled. I thought, yay, these guys aren't just going to listen to the FDA. And then I spent about an hour thinking about it a little deeper. And then I was horrified, because what does this mean? We now have a country where major scientific institutions simply reject the FDA's advice and their rulings. I don't blame them in this case. I would do the same thing. But it's a really dangerous precedent, because when you're not believing the group that's supposed to be the final arbiter of drug safety and usefulness in this country, who are you going to believe? And does that make anyone surprised when you hear that other people are saying, why should I believe your vaccines work? Why should I believe anything you say? When the FDA is universally approving a drug we know is worthless. So I don't mean to beat up on the FDA. I have friends there. They do a lot of great things. But I just think we live in a world now where something like this is possible, and it's way more dangerous than people think it is. I'll give you one other example. I live in New York State most of the time, and I actually live in Columbia County, which is the national epicenter for Lyme disease. Not something I'm proud of, but there it is. We have a Lyme law in New York. You know what that Lyme law says? It says insurance needs to pay for extended antibiotic treatment for people who have Lyme, long-term Lyme, the consequences of long-term Lyme. It has never been proved to work. We have seen people die from excessive antibiotics, IV antibiotics for Lyme, but we've never had any data that said, hey, it works. And so now we have a law requiring doctors in the state of New York to offer subpar and sometimes dangerous treatments to sick people. If they don't, they face serious penalties. So again, how should we think about the authorities when these things are happening? You know, we're having bitter, angry debates over face masks. I mean, people say it's their right to vaccinate themselves, and it is their right to vaccinate themselves. I don't have a problem with that, except if you don't want to vaccinate yourself, then don't go near my kids, don't go in my workplace, don't go to my school, stay home. If you want to incur the risk, that's fine, but don't impact anyone else. And I think we all know that that is not a tenable position. You know, it's been more than a decade since I published that book, Denialism, and I never even wanted to write the book. I didn't want to do it because I didn't want the issue to be important enough to warrant my sustained attention. I put it off for years, hoping that if I ignored the problem, it would just vanish. There must be a name for that kind of unwillingness to acknowledge reality. Well, anyway, finally, I felt as if society needed it to make critical choices and that I thought were obvious, but clearly were not. And it was a problem, but I certainly never thought we'd be seeing denialism as a way of life or find out so clearly or so soon what that might mean in this country. At the time that I wrote it, I was animated by a number of people, the growing number of people really, who confronted with an unpleasant reality, chose to embrace a more comfortable lie. Denial's normal. We all are in denial over something once in a while. That's fine. It's a coping mechanism. But denialism is different. That's when an entire society says, I'm going to react to this problem by ignoring it, or pretending it isn't true, or pretending that something else is the cause or the reason. And, you know, we can look at how many people are dying in this country, in part because the previous president refused to test people for COVID, as if not testing people would mean they wouldn't get sick. And we can say Donald Trump's an idiot, I'm good with that, but he's not the whole problem. He's probably not even the major problem, he's more of a symptom. And I also want to make it clear that this sort of anti-science posture is not a right-wing thing. It's not a left-wing thing, it's an every-wing thing, because the hatred of GMOs is just as virulent as the hatred of, you know, climate change, or the confusion or refusal to acknowledge climate change. No person has ever been made sick from eating a GMO in the history of the world, as far as I can tell, and I pay a lot of attention. Nonetheless, about a third of Americans say to do everything they can to avoid consuming GMOs. Now, this may be a confusion about science. It may have something to do with what people think the science is for, or the fact that companies own things that they believe they shouldn't own, but we don't, you know, we don't look at this in a sort of direct, intelligent way. And I'm really more concerned about that than almost anything else. The fact that we kind of just confuse our desires, confuse our anger. And, you know, I will not dwell on the COVID vaccines, but we're 2 years into the largest and most aggressive vaccine campaign in human history. As of a couple weeks ago, there were about 10 billion shots administered, more than 500 million in this country. And if you've been vaccinated and received a booster, your risk of dying or being hospitalized is 90% lower than if you haven't. I actually think it's the greatest scientific story of our time, one of the greatest of all time. No, we all know that no vaccine has ever been produced that rapidly. And yet, yesterday, 1,000 people died in America. Today, 1,000 people will die in America. These are good numbers because a couple of weeks ago, it was twice as many. This is going on and on. This is like having 3, 4 fully loaded 777s falling out of the sky every day. And mostly, not always, but mostly it's happening because people are rejecting science. And I just feel that, you know, you can talk about fear, you can talk about anger, but what we really need to do is have some understanding that people are afraid. And, you know, I always thought reason is a sort of unimpeachable good. If you have the facts, you have a winner. That's the way I've always seen the world. And I don't know where or when I first read Milton, but I was young. And I have forgotten pretty much all of it except for one quote. And what it basically said was, if truth is on the battlefield, then nothing else will matter. Let truth and falsehood grapple, because whoever knew truth to lose a battle. Well, John Milton never encountered Donald Trump. And again, not just Donald Trump, but we live in a world where truth just doesn't always win, and I'm not sure that it usually wins. And that really scares the hell out of me. When leading officials say that what happened on January 6, 2020 was a legitimate form of political discourse, we have a really big problem. And don't be surprised that people don't believe in science. They don't believe in anything. And you may think, why am I talking about the Capitol riot? I'm talking about it because I think if our entire Enlightenment system of belief is eroded, then words like science and progress become completely unmoored from their meanings. And the effects are incalculable, and we've seen them. We are, those notions of progress are under assault with a ferocity we have not seen in hundreds of years. And I've learned this in many, many ways, and it's been very difficult to listen to people and watch them suffer. But because we don't have endless amount of time, I do want to give a couple examples of both things that scare me and maybe one or two things that excite me, or at least make me feel like humanity is possible. I want to say one thing about Fauci, though, and it's not really about Fauci, it's about all of you. Some of you want to be public servants in public health. That guy has a full-time Secret Service detail now. He's had very significant death threats. So have his daughters, who are adults and have nothing to do with him professionally. And I just wonder which of you want to go into public service after seeing this. Because that guy, you can like him or not, but he spent 50 years doing this job and he could have done other jobs. And to be vilified for working hard for what seems like the good is a pretty scary thing. But I think at some point, science became a sort of political event in this country. It began to be like the teachers union or the Teamsters. And scientific information has been considered an opinion from an interest group. And that never used to happen. I mean, it really never used to happen. In the wake of Sputnik, President Eisenhower, a Republican, created the post of presidential science advisor. He appointed the Harvard chemist George Kistiakowsky. Jerome Weissner, a Democrat who would become president of MIT, sat on the advisory committee, and they met often. The next year, John F. Kennedy, a Democrat and a man Eisenhower did not like, became president. And you know what happened with the Science Council? Kistiakowsky and Weissner simply switched roles. Could you imagine that today? Mostly what they do now is try to prosecute the people who've had the jobs before. I mean, we live in a world that is so polarized, you can't be surprised that people are upset or that they don't understand what the stakes are. And I will tell you, I'll just give you a couple examples. I wrote a story about an attempt to make genetically modified mosquitoes to defeat dengue in Brazil, a company named Oxitec. And dengue had come back, it's about 7 or 8 years ago, to Key West, to America. And Key West is a tourist town. And so the Oxitec guys thought, hey, maybe we can get them to use these GM mosquitoes. They mate, the eggs die, all the mosquitoes die, and there's no dengue when it works properly, and it was working properly. So they gave a presentation. Key West is a kind of rich-ish Palo Alto kind of place. And everyone drove up in their Lexuses because there weren't Teslas then. And they viciously attacked these people for trying to introduce GM mosquitoes into their natural world. So what were they doing? And what are they doing? They were dumping DuPont chemicals in the backyard to kill the mosquitoes and to kill everything else. So that to them, to these environmentally sincere people, was more valuable than introducing a biological solution because it was genetically altered. You know, these sort of things, a few years ago, Ingrid Newkirk who is the head of PETA and a person I wrote a profile of, and is a very polarizing human being. But she's not a dumb woman. And about 10 years ago, she offered $1 million to the first group that could make lab chicken taste like real chicken. And it's $1 million isn't much for this sort of thing, but it got things going. Do you know what the rank and file of PETA, how they responded to this? They responded by viciously attacking Ingrid because they didn't want people to have the taste of meat. And Ingrid's whole thing was, this is animal suffering. I don't, taste whatever you want if you're not killing animals. But we've kind of gotten to a position where we don't really think about the science. We just think about emotion. And that is so, so damaging. And I do want to take a bunch of questions or any questions, but I just want to leave you with one little fact, which is there was a guy who was pretty much everything I don't believe in. He was a right-wing evangelical person who was responsible more for the vigorous attack on abortion than anyone else in this country. He was an antediluvian nut job named C. Everett Koop. He dressed like he was in Brigadoon and he looked like he was trying to be Abraham Lincoln. He was gruff, unpleasant, dismissive, but he was nominated by Ronald Reagan to be the Surgeon General, and liberals held it up for a year. It was a vicious attack. Eventually, they just said, well, the hell with it. He's just a Surgeon General. No one's ever heard of a Surgeon General before. So they appointed him, and the first thing they did was say, do a report on AIDS, because they were so sure he would do something that basically condemned behavior of homosexuals as evil. He spent a year, and he came back and said, by the time kids are in 4th grade, they should learn what a condom is and how to put it on. This was like a nuclear bomb dropping. So everyone was pissed off at him, and they asked him to do one other thing, which is a report on abortion, his thing, because they knew he would condemn abortion. And he spent a year. And one of his people called me. I was working at the Washington Post then. And he said, you better come see Koop. He's not issuing the report. So I went down and said, what's going on? He said, I interviewed hundreds of people, and I just can't say in every case that it's the right thing or the wrong thing to do, to have an abortion. I don't believe in it, but I can't say it's always the right thing to prevent a woman from having one. In the end, he was loved by the liberals and hated by the people who worshiped him in the beginning. And I don't know how delighted he would be with the world around him today, but when I saw him right before he died, I said, what happened to you? He said, nothing. I have not changed my stripes. I still believe in everything I always believed in, but I also know that facts are facts and science is science. And that world just doesn't exist right now. And we need to work really hard to get back at it. So I'm going to stop. I know I probably went on too long.
Thank you so much. Let me, for the sake of time, I will synthesize some of the questions that were put in the chat room. So you referred to us insofar as who are in attendance are in public health or in the global health. We refer to us as public servants. How can we, public servants, face the societal problem of denialism and rebuild public trust in science, as well as help to teach the public about the importance of uncertainty that's inherent to scientific work? Because we seem unsensitized in general in our ability to cope with uncertainty anyway, whether in science or in life, and whether this is like, fear driven or calculated rationally. So yeah, to repeat the question, how can we as public servants face this societal problem and rebuild trust?
There are a couple two big questions there. One is about uncertainty and one is about public trust. Let me start with public trust. First of all, as all you guys are clearly aware, there are no magic answers to any of this. But I think one of the things as scientists and as educators and as public health officials we can do is not be condescending assholes. And often that's what we are. Acknowledge the fact that, yeah, there's Bobby Kennedy out there and he's evil. But a lot of moms are just afraid that they're going to harm their kids when they give them a vaccination. And you can talk to them like a human being, let them ask questions and answer them. And I've had really good luck with that. I've also had really good luck doing that kind of thing with people's opposition to GMOs because they're not usually opposed to GMOs. They're opposed to the corporate ownership of seeds. And that's a whole different thing. And we can have a different conversation about that someday. But when it comes to the science, I just want people to realize it. The thing about uncertainty is a much more difficult problem. And I think it's actually the crux of all of this. I mean, I have this stupid theory, but 150 years ago, if you were sitting in your office, if you looked at all the things around you, you would have either made them or understood how they were made. And I don't think that's true of almost anything. Like I'm beaming all over the world right now, and I do this all the time. I teach. I have no technical idea how that happens. When I call my daughter in Texas from New York, I don't know how it goes to geosynchronous orbit 28,000 miles away and then into her phone 1 second later. And I'm good with that. But I think a lot of people, the accretion of not really having a firm grip on the things in their lives makes them feel crazy. It's a cumulative problem. And I think a lot of people want control. So they react by saying, don't tell me what to do with your stupid science. And again, it would be one of the things about uncertainty is if you can acknowledge uncertainty and stop acting like, there's this belief, and often scientists have it and spread it, that science is some sort of 100% magic fact. It's not. There's nothing that's 100% in biology. There's nothing that's 100% in physics. As far as I can tell, they haven't worked out the theory of relativity 100%. People still get on bridges, and they seem to be okay with that. So I think part of the problem is that we've set ourselves up to fail by acting like we have the answers. There's science, and science answers everything. Instead of saying, science can move us in a certain direction, and it's done an amazing job. A lot of these people who are anti-science, they get Netflix. They're okay with that. They're okay with cell phones. They're okay with, all sorts of things in modern technology, which are useful to them. So we have to kind of help people see the big picture. And then the only other thing I would say about all this is I think every kid in school should take two things: a statistics class, and by kid, I mean kid, because everyone talks about the odds of something bad happening, but the odds, like if it's 1 in 7 as opposed to 1 in 700 million, it's worth knowing the difference, and lots of people don't. And I think the other thing would be, when I was a kid, this is how old I am, I dissected frogs in school. I'd love to see 8-year-olds play with genes in school. Turn frogs a different color than they are. It's not that hard to do. Learn about CRISPR, learn about editing genes. If that generation understands it, they'll embrace it and they won't feel crazy about it. My generation, they're just afraid. And probably we should just die off and wait for the next one. But
someone asked, isn't the production of science an elite endeavor? And
what do you mean?
Briefly.
Elite endeavor, I mean, what do you mean? Do you have to be smart or sophisticated or trained? Sure. Yeah, you have to be an expert. It's fine to be an expert. We need experts, but experts still have to communicate. One of my problems with so many people, and this is why I teach at Stanford and MIT, is I think everyone who works in science should be able to go tell a normal person what they do, and to do it in a way that they will understand and maybe even appreciate. That doesn't mean every bench scientist has to be able to write like a journalist or a New Yorker writer. But if you're working on a project and your attitude is, I'm elite and I'm doing something really important, and I don't have to explain it to you because I don't have the time, you're going to lose your funding, and you deserve to lose your funding. That's just not the world we live in.
Okay. Thank you so much, Michael.
Yeah, I'm sorry that I guess I couldn't get to all your questions, but I appreciate that.
Yeah, I will capture them and we can send them to you if you would like.
Okay.
Thank you so much for speaking with us today.
My pleasure, and I definitely didn't solve any problems, but I'm glad to see that you guys are trying to think about the problems. That's part of the way home.
Yes, exactly. You've given us much food for thought. Thank you so much.
Okay. Thanks again. Okay. Bye. Have a good time the rest of the day.
Yeah. Okay. So everyone, what we will be doing next is we will be breaking out into smaller groups to do a breakout activity. We want to take a reflective pause and to think about our relationship with the public. Where has it gone wrong? What, with the COVID-19 pandemic in mind, what did we as a health community do successfully to ameliorate the rise in anti-science sentiments, and what did we do to exacerbate it? What lessons should we carry forward regarding what worked and what could we do differently next time? So to facilitate this discussion in a meaningful and interactive way, let's now break into smaller groups. Each group will have a moderator who is prepared with a small series of prompts to help us guide the conversation. The same rules are going to apply in the breakout rooms. Your audio and your audio and visual functions will be turned on during the breakout rooms, but the rules apply. So if you're rude or if you disrupt the flow of the exercise, the moderators will have to remove you from the room. We have 20 minutes for this conversation. We might need to shorten it to 15, if that's okay, before regrouping and debriefing. So on that note, Kevin, would you mind enabling everybody's audio visual and fantastic, and break us out into our rooms? Everyone is here. Hi, everyone. Thank you. And thank you so much to our moderators for leading these groups, and for everyone else in attendance for sticking with us for this really long half-day workshop on the important topic of, what is anti-science? What is it not? And like, what do we do about it? So we are a little bit over time. So I think let's give ourselves, let's just try to be brief, and then we'll go from there. The moderators can, I invite you guys to share what your groups talked about in this session. And then we will have a break before getting into the final installment of this workshop, which is arguably, one of the most important ones, which is like, how do we do research into this? Where do we take the future of a research agenda into this phenomenon from through a transdisciplinary lens? So I guess I'll just get started since I'm ready to go. In our group, we talked about, so the answer to the question of like, what were some key missteps? We talked about crimes of omission, how, the scientific community didn't necessarily communicate well. For example, regarding the masks, there was confusion about like, are they available or are they effective? Like somehow this got confused. And so for the sake of simplicity, in delivering messages, we may have inadvertently obfuscated the truth. We also talked about how, pharma companies also participated in simultaneously ameliorating and exacerbating the phenomena. Obviously, thankfully, they manufactured a vaccine, but then, we can look backwards from the vantage point of today, and we can remember that, at the beginning, before they had created the vaccine, companies like Pfizer and Moderna, they said they were going to distribute the vaccine globally once they created it. And that never happened. And so is this anti-scientific? And really is, fiduciary responsibility to corporate shareholders in a context of global capitalism. Is that anti-scientific? And so, and then for, I guess, real quickly for, thinking about how to prepare to respond adequately in the future, we had a very abbreviated but important debate on whether the issue is to improve scientific communication or communication about science to the wider public, or if actually building relationships and building networks is the way forward. Okay, so why don't we pass it along to Liz?
All right, so there was some overlap in what our group spoke about. And part of it was learning through the pandemic, learning as we go along, and making mistakes and not educating the public that it is a learning process. Science is a learning process. Also the language that we use and lots of jargon. So meeting people where they're at and perhaps the language that people use. And then perhaps we could have done a better job, we as scientists could have done a better job at incorporating more behavioral science rather than focusing on the bench science. So for solutions looking forward, we discussed that we as scientists need to do a better job in policing ourselves in terms of our behavior, in terms of our what we publish, really doing a better job at holding ourselves at a higher standard. And then finding a way for clear messaging through social media. And then I really like this one comment by Peter, and perhaps if he's still on, he could fill in as well. But to be scientists need to be better communicators. So presenting in public discourse. Peter suggested the idea that if you have the NIH funding, that there's an expectation that instead of, well, in addition to listing your publications, that you also have a component where you're required to educate the public. So really engage with the public. Did I miss anything from Peter and Laura?
Just a friendly amendment that you're requested to report on your communication with the public. In some cases, it may be totally inappropriate, but like people report all their scientific publications, they should also report all of their public communications, just really encouraging that and setting that as an expectation.
So it sounds like you're talking about transparency.
That would also help for transparency, but more just that people get used to hearing from scientists and scientists get used to speaking publicly and communicating. Not that they're hiding something, but they just need to talk about what they're doing. Yes. The point was made earlier, but that would be one particular way of encouraging that.
And perhaps part of that is in training programs is to teach scientists how to communicate. So I don't think that's really taught. I know I'm in a PhD program and that's not necessarily taught to us, is how to communicate the science to the general public.
Okay, thank you so much. Who wants to go next of our moderators?
I'm gonna go next. I think, a lot of overlap we really focused on in terms of the problems that we faced, issues with communication, mixed messaging, something that came up in our panel discussions, just the fact that it takes a while with something like COVID-19 being brand new. It takes a while for, scientists to come to consensus, and meanwhile, the public is waiting. And that's all part of a normal process of figuring things out and developing vaccines. But how do we communicate better in those periods of uncertainty while we're still learning? I think we had some really interesting discussion around solutions, which really came down to bringing a range of stakeholders to the table, engaging communities, and figuring out, how we can give tailored messaging to those communities and identify the right leaders and the right sort of communicators for specific communities. We had Gail join us, who's a filmmaker who was able to speak of her experience as a filmmaker being approached by the CDC and working with with them on sort of creative ways to reach the public, which was really interesting. And so it's, you know, thinking about innovative ways to reach people the way that works. You know, we know that The Walking Dead is really interesting, and so that's what she's worked on, and that's why she was approached. And so how can we sort of leverage that type of media and skill within public health? I don't know if anyone from my group wants to add any other comments.
For the sake of time, why don't we move on to the next group?
Thanks.
Thank you.
I can go quickly. Most of what our group had talked about has already been said. Just kind of piggybacking on what Caitlin said, we talked about that there wasn't a actual discussion on the scientific process, that it's iterative and that it'll change over time. And that wasn't communicated well. They tried to simplify the messaging of this is the this is the end product, like you have to mask, but not how they got there. And so we had said that a solution to that is actually giving them basically an insider look onto the scientific process and trying to make that communicable and accessible to the population. We had talked about FLIC, which was one of using a lot of climate change education, and to really focus on that type of education and that type of kind of methodology to talk to the public, because I think we were talking a lot about the experts and people were talking much higher level than the community were talking. So that's another big point, is how to communicate effectively to the end user. And the third, I think we've mentioned it before, but using local experts and not people outside the community, because one example was that people in this community were trusting their local experts or local healers or local medical providers, but then why would they weren't trusting the larger state. So it might be better to focus, have the messaging come from that local context.
Cool. And then Marco and Jawad, did you guys co-moderate? Or
Sorry. I had a technical issue, so I got switched between two conversations in the middle of it. What I can speak very briefly about the very short conversation that I've had before I switched, but it's kind of connected. So the first point that came up was kind of an elaboration on what Michael Spector was saying. So if failure of the scientific community to really educate the public effectively on what science is, what it's supposed to do, why, and to what extent controversies and disagreement are integral and not an issue in the way science is done. And then we moved on, and Gabriel made a point that I think is very important, that is how some facts or some ideas, some thoughts that we might perceive as conspiratorial, once they are investigated and connected to research, they turn out not to be so conspiratorial after all, that there is some layer of agency and of practice that kind of informs those conspiratorial thoughts. And then in the middle of this super interesting conversation, I got switched. So maybe Jawad can take over.
Yeah, thank you, Marco. So there was a bit of confusion. So, but generally what most of the points have been discussed by all other moderators, and just a few other points that I think that we discussed or touched upon was some shortcomings of how our response has been to the pandemic. Was number one, the flip-flopping of the guidelines of the WHO. For instance, at one point they said that masks are not necessary, and then at another point masks are necessary. So it affects or impacts the public and their trust. Although that really depended upon how the evidence is also evolving over time. But I mean, an international organization, for instance, changing their narrative, it does affect the public trust. That is one point that came up. Then another thing that we talked about was the non-neutral, the neutral stance of some of the researchers and not picking the correct or the evidence-based side. That was another thing. And then the poor writing, especially when it comes to journalism, of course, with not all journalists, but with some of the journalism pieces that were not up to the mark. And like all of you, we discussed about how effective communication is important. And if I break it down into that, into finding the right language that can appeal the audience, or that could be, or articles that could be written in a way that audience actually understand, and that could be different way for different sorts of groups. And another thing was that Gabriel brought up was the top-down. We see the top-down approach when it gets to telling people what to do and what not to do. It should rather be the bottom-up approach, where we actually listen to people and see that what their perspective is, and then like go from there, and then think about like how we need to address those issues and problems. And then particularly also by targeting the intermediary stakeholders. So there is a population, and then there is scientific community, and the intermediary stakeholders are the key people that actually translate the evidence. So we should have a particular focus on those people. And lastly, we should clean up the mess in academia. And by that, I mean that our stance, or any academician's stance, should be respected, and they should not be pushed to take one side or another. That is like sort of what we discussed.
Wow, awesome, guys. Sounds like you had a great discussion. So, okay, it is 12:02 right now. Why don't we take a 10-minute break? Go to the bathroom, get something to drink, have a snack, or hang out here and chat with each other for 10 minutes. We can come back, or it's 12:03 now. At 12:13, in 10 minutes, we'll reconvene for our final portion of the session, where we try to integrate some of the what we've learned from our panelists, our speakers, and from each other, integrate that into designing, transdisciplinary research into anti-science. So on that note, let's take a break and see you guys in 10 minutes from now. Time flies when you're running a 4-hour conference. Wow. But we have reached the final portion of today's satellite session. We've heard from experts across disciplines on different aspects or dimensions of the anti-science phenomena. We've highlighted some of the biggest challenges and generated some solutions to those problems collectively. In this last session, we want to break into groups again and integrate everything that we've been talking about thus far, including your own experiences and your own disciplinary backgrounds, to try to apply that towards designing a transdisciplinary research agenda for the quote unquote anti-science problem. So we will break into 3 groups. They'll be a little bit larger this time. I don't know if it's going to go as it did last time. It looks like you'll have to manually add yourself to groups. So just be mindful of that. And our moderators have some questions that will help us to address any aspect of the phenomena that your group collectively decides upon. And then we'll work on that in 25 minutes, and then we'll share what we came up with together, and make some final comments on what we think should be included in a transdisciplinary agenda into these phenomena moving forward, because we do have a unique opportunity to circumscribe a field that is not yet well conceptualized or defined, even though we all agree this is very important work. So on that note, Kevin, if you don't mind breaking us out, that'd be great. Okay, welcome back, everyone. Let us now debrief. We have 17 minutes before this scheduled event is, or this event is scheduled to close, and I would like to save some time for some concluding remarks. So why don't we start off with Jawad and your co-moderator. Would you like to share what your group discussed?
Yeah, sure. I did it with Shama. And the question that we actually came up with was that what is science to the public? And sort of we want to know that what exactly is, what does this term science stands for, and especially in respect to what do public think of this term on the whole, science. And we had some discussions regarding, so one of the issues is that it might be subjective, like other people, some people, scientific people might think about it in a different way, others might think about it in a different way. And one of the things that Michael, for instance, came up with was like, even to his residents in his program that he gave research papers to, without any conclusion, they came up with different conclusions that the one particular research paper that was given to them. So we find that there is a heterogeneity in how we perceive or how everyone perceives science. So that is what we are going to we want to first figure out that, and we think that's kind of the root or the foundation that will build upon much broader research questions and much broader discussion. And in order to approach that question, we would use more mixed methods approach, incorporating more innovative research methods. For instance, the first one is, for instance, having 4 focus group discussions and having innovative approaches in a way that we can track people through social media and reach out to different sorts of groups who have different understandings of science, and then have one-on-one qualitative or focus group interviews with them to understand their perspective of science. And in addition to that, we want to deploy a population level, a bigger surveys in which we could get an idea of what population really thinks about, representative samples of populations think about what science is. For this, we would require, this research needs to be interdisciplinary, transdisciplinary, and there would be a number of different disciplines we would like to incorporate. For instance, epidemiologists is one, social and conventional media, we need to partner with them. We need to partner with, may have to partner with the private sector. And one of the most important things is also the education department. And the education sector is somewhat the place where we can also use them to, for instance, teach or at least acquaint people with the phenomenon of science and how science should be perceived and how the logical reasoning should be talked about. Once we have the results of this research, and based on the results, we can then move on to translating evidence into action. And we also need to look into that. We just don't do research for the sake of research, but also translate into actionable measures. So translating research into action, and then using our networks also to disseminate it so that people have a wider understanding of what exactly science is. And then on the basis of that, it can make foundation for further research, but also it's very important to put that into practice. That is sort of what we discussed. If there is something missing, probably Shama could comment on that.
No, I think, we were trying to think about doing like a population kind of survey, then the focus groups, and then getting down to the nitty gritty. But really the gist of our question is we need to know the problem. And first, before you even need to know anti-science, we need to know what they even think of science.
Yeah.
To go from the beginning. So
awesome. I love how cross-sectoral and full life cycle in your group. All right, Caitlin, are you there? Do you want to debrief on what our group? Maybe if Caitlin's not there, why don't Emma and Marco? Why don't you guys go ahead and keep time management in mind? I'm sorry that we're rushing.
I gave Marco the session off to just contribute his ideas, and I'll take notes. I'll talk about mine, and then anybody from the group, please chime in. So the research question that our group focused on was wanting to understand better the drivers of information, specifically with respect to COVID, how people make the decisions they're making, how they ultimately end up at a decision, whether it be not to wear a mask, how things that are very contrary to the vast majority of scientists' opinions actually play out and can result in real world people ignoring well-known and well-established mitigation strategies when it comes to literally saving people's lives. And one of the things that came up in a few different ways was how important that it is to this research question. It's really critical to understand the motivations and how people are coming to their end ideology, or how they're coming to their end conclusions. What do they think about scientists? What do they think we do? What do they think, like trying to understand how people's decisions are being made. And then the other really critical piece is having the contextual information about the settings in which these misinformation spreads and where these attitudes also spread further. We need to understand the nuances of the neighborhoods and the specific places that people are living. Maybe it could be a political characteristic and stuff like that, that is important to scale our understanding or potential interventions, because we need to know, are there certain places where this is true or this is not true, about our fundamental understanding of how misinformation spreads and gets worse, or becomes more pervasive, I guess. Let's see. So we proposed a research study that specifically has attention to detail and brings in disciplines that have an understanding of the nuances of being human and the complicated dynamics that exist in interpersonal interactions and just naturally by being a human being in a larger society. It's going to be really important to engage with political and legislative bodies, not just like actual policymakers, but also in the academic setting. So like law professors, we're going to need to understand how free speech and academic freedom plays out in these conversations. So not only are we able to understand what's happening, but we can also ensure that we're doing things that are ethically and morally sound, I think, and where I think, especially in some context, it's kind of a fuzzy, it's a gray area where the actual ethical boundary can be. And then the one last discipline that we need to make sure that we're incorporating is related to communication. So we need to keep humility. We need to ensure that we are listening and hearing people and keeping us from seeing one way or one perspective as right or not. We're not going into these conversations to change someone's mind or have them have an epiphany about the greater society, whatever principle. We just want them, Marco said this and I loved it, we just want them to get vaccinated. We don't need to change their whole perspective about how science or how the world works, but helping people be safe and healthy. And so some of the future directions, or honestly, I think our mindset was that there is no end goal. This is a continuous process, and that we're starting at this one part where we need to have a deeper understanding, but that's just a first step. We need to dive deeper to understand
Great.
One last thing, because I didn't reflect my group enough, but policy is really important because we need to protect the people who are actually affected day to day by these things. So policy. Okay, sorry.
No, fantastic, Emma. Thank you so much. Okay, and I'll just briefly I'll share about our group and then moving to concluding remarks, because I would like also people to have jump in and say more things if they would like to as well. So our group, we decided collectively that we want to know how to theorize and conceptualize and define this problem that we're provisionally calling anti-science. And in order to be able to do so, we need to have some sort of criteria for, deciding what counts as anti-science or not. And the data that we need, to do that, we think should be empirical first and foremost, and that empirical data can inform the more formal aspects of our research design, and that we want qualitative data to inform quantitative metrics that we can use in the research project to get a sense of what the problem is. And we propose designing a research study that looks at scientists and non-scientists as two groups of people, and that looks at either like their beliefs or their attitudes or their motivations or their ideas. We're not sure exactly what the right variable is there, but how their relationship to science. And we would like to be able to do that in a way that we can compare across different national contexts so that we can make this global in scope. By designing the project in this way, we think that this research could contribute to increasing, transdisciplinary, interdisciplinary research, breaking us out of our disciplinary silos. We talked about wanting to have anthropologists, sociologists, economists, epidemiologists, maybe even some synthetic biologists on our team, to name a few. But most importantly, we talked about the importance of having a lay scientist, someone who's not specialized, but who cares, to participate in the design, execution, analysis, and communication of this research the whole way through. And in terms of moving forward, similar to what Emma has said, this is really just to continue having conversations such as these, because there are no quick fixes, and we are slowly and beginning to do the work, right, of figuring out what is this thing that we all identify as a problem. How do we circumscribe it and flesh it out? So on that note, let me just share a portion of my screen. All right. I just wanted to talk, so these are notes I was taking, like some key takeaways, okay, from the talk today. And then I would also like invite anyone else to add things in that I have missed. So takeaways from this really great talk conversation today. We have this kind of assumption that the global health community urgently needs to combat anti-science. But what we've heard today and talked about today is that we can't really intervene into a problem that has not yet been well defined. We need to slow down and understand what the problem is first before we try to counter it or combat it. And that was part of our objective today. We also And we also heard that, anti-science is not some homogenous or monolithic group, right? This is an emergent and a complex phenomena. So there's a lot to understand if we are going to eventually be able to ameliorate the consequences or the threats that it may pose to global health efforts. There's another common assumption that anti-science is antithetical to science per se. But we've heard speakers talk about how anti-science is, anything that goes against scientific evidence, that it's actually not the same as distrust in science, but it has more to do with values and culture and politics. We heard from some speakers that, it results from a lack of information, but then we heard on the other side of the spectrum that it's not so much about a lack of information, but more an effect of social and structural inequalities that are pretty normal or pretty status quo in the world that we live in. So a takeaway, I think, is that facts, are not separable from values. And that the problem might not necessarily be with the facticity of scientific evidence per se, but there are also structural drivers of anti-science that exist far beyond, the knowledge economy of of the scientific knowledge production. I would like to suggest that anti-science is not the right label for describing the problem that we seek to address. And a part of me was really compelled to just start the whole session like that, but I didn't know if that was too provocative. And it turns out that pretty much all of our speakers kind of said that all anyway. So this might not be the right label, but at the same time, we have not yet, I don't think anyone has yet proposed a more appropriate moniker. And I think that that's okay for now, because what we do have clarity upon is, for starters, that the prefix anti is pretty polarizing and reductively oppositional in a way that defeats some of our more noble purposes. And to kind of come full circle, the point we don't have to have an answer today. We're just slowing down this conversation and learning as much as we can through a transdisciplinary lens about what the problem is. And then we can name it, once we have a little bit more clarity. Another assumption that vaccine opposition, the spread of mis and disinformation, climate change, that these are inherently anti-scientific. That is an assumption. We heard that, there's a lot about vaccine opposition that has nothing to do with science necessarily. Like it could do with personal risk calculations or phobias of needles or, inheriting the trauma of colonialism. These are all interrelated, but they're not reducible to anti-science, to science alone. Takeaway is that we can think about anti-science as a social phenomena, and that all of these priority areas are an important and integral aspect of this problem space, but that anti-science is not reducible to any of these three areas on their own. And that's important to remember because because if we only focus on these three things, then we're not going to really be equipped to address emergent other new forms of anti-science if and when they do likely arise in the future. And again, just, okay, so there's that. I'm just kind of go through. There's this assumption that scientific information is supposed to transmit as rational action, right? That if we just get the right information to the people, then they will get vaccinated, for example. This hinges on an information deficit model, and that may be useful sometimes, but in terms of thinking forward about a research agenda and strategies, that this alone will not suffice. Addressing anti-science will require developing new ways of thinking about and studying this problem beyond a matter of information and messaging and communications, even though, again, that is a very important part of the overall endeavor. Let's see. And that, right. Okay, I'll stop there. And then the last assumption is that the general public and the less educated masses, those are the anti-science threat. A key takeaway from the conversation today is we also need to look at the systems in which we are all embedded, because the systems in which we exist can also function as anti-scientific. And by systems, I mean political institutions, legal bodies, corporate capitalism, the knowledge economy itself, right? Like publish or perish. When taken too far, that can become anti-scientific. So the point here, though, is to encourage ourselves, you guys and each other, to look at ourselves, look at the systems that we're embedded in, and to critically evaluate who is anti-scientific beyond just finger pointing to the general public. And in that note, I think also it's important to differentiate anti-science from counter-normative views and behaviors. Okay, those are the takeaways that I got. We're a little bit over time, so if you need to leave, that's totally okay. But I did just want to allow, since this is a interactive and collective discussion, does anyone else have other takeaways that I may have missed that you would like to contribute and repeat before we close the session?
Maybe I want to say one thing about the assumption that if everybody had the right information and all the information was objective, that they'd all decide to get a vaccine if they hadn't before. But I think some people make a rational decision where they say, yeah, I know, but I don't really care, because I care more about the minuscule effect that I might have on my body rather than the general health of the population. And so that's a value decision. It's not a question of not understanding or not knowing. Right. And that's where my dad used to say, in a democracy, your right to extend your hand stops where my nose begins. So we, unfortunately, I think, need to legislate when that person's nose actually is known to begin. And if you like Michael Spector said before, if you decide that you don't want to get vaccinated, then you must stay in your house, because we've decided as a society that this is unacceptable for you to put other people at risk. Yeah, there might be some people who deny, that climate change is happening, but I think there's a great number of people who don't deny it, who just don't care because it affects their economical bottom line. And so the only way to get across those people is to, again, legislate that they can't pollute, that they can't dump carbon into the atmosphere. So maybe we're also attacking this from the point of, if people were just to understand, they'd all see it as we do. And that may not be true.
Yes, so let's not assume that humans are rational beings all the time.
Valid assumption.
Okay. And again, we are over time, but if
Did we lose Melissa?
Given everybody's facial expressions, I think yes, we did.
Oh dear.
Oh no.
May I just say, I'm not a social scientist.
I'm here. Hey guys, I'm back. Sorry.
I'm sorry for.
No,
I'm sorry for taking your time.
No.
With my observations, but it is disquieting that we're here because of this crisis where people are dying, and there is pretty obvious evidence that this is a politically driven crisis. And I understand that in academia, there are incentives to avoid politics at all costs. And this has been the case with, and by the way, I prefer the word pseudoscience. It's been used for decades. There's been a reluctance of academia to deal with pseudoscience and countering it, political pseudoscience. This is a political crisis. Avoiding that, I think, is unethical. This requires, and dealing with the question of free speech and academic freedom. Free speech is on a pendulum. It can be the societal view of it can be changed. People do not have free speech that endangers other people should not be thought of as protected speech. It's not. And sorry, I will mute myself now.
I wanted to maybe have one word on the fact that maybe something that unfortunately we were not, at least in my experience in the breakout rooms, that even though, as Michael says, as many people have said in the course of this panel, this is a crisis that kills people. It is an emergency in a way. It is not only that, it is also somehow an opportunity to reimagine science into something better. Mm-hmm. That closes, this is a sign of an issue, of a deep and long-lasting historical issue, of the wedge between scientific research and the public. Yes, it is terrible, but maybe the fact that it is so terrible makes us finally think about ways to reapproximate the truth and close this gap and reimagine science in a way that just is better for the functioning of society. So not only a crisis, or yes, a crisis, but also something that is a sign that makes us think about improvements. And I don't know if we lost you again, Mel. Yeah, we lost Mel again.
Looks like we really lost her now.
Maybe. But a lot of people have left already.
What do we do without a leader?
I can try to get in touch with. Oh, there she is.
Sorry, made it back. I just want, I have the time, so I just am putting a link in case the platform kicks us off. So here's a link to my, if for anyone who would like to continue the conversation. Of course, that's not required. It's voluntary. But there, we still seem to have more to say. Marco, can you? It is a crisis. It is an emergency. It's also an opportunity to reimagine science.
Yeah, that's fundamentally what I was trying to say. Yeah.
And to link that to what Michael was saying, do you think there's a way, it's an opportunity to reimagine science in a way that it can be responsive to political questions? Not political in the sense of like party politics, but in the more philosophical sense of like how to live well together?
I would hope so. That's my hope, really. It's difficult, but that is, in a way, if one wants to think, again, philosophically, ideally, about the functioning of science in society, it is to make life easier, to make life better, to resist forces that push us in directions we might not want to go. And in a way, I think that this crisis might offer us the opportunity to rethink whether or not the science we are living with now is really doing that. And how, if it isn't, how it could.
So right now, science is not able to answer the question of how to live well together. I'm going to pose that as a provocative statement, and maybe somebody can agree or disagree with me, right? It tells us a lot, but
I mean, it's a big philosophical question, but I see that Emma has her hand up.
I got distracted by Mel freezing again and totally lost my train of thought. Oh, I remember. So I think about it from like a DEI perspective, like, and I love what you're saying, Marco, and I'm very into the inclusion of racial ethnic minorities, but every act of inclusion that's specifically for one group excludes another. And it doesn't matter who's right or wrong. If we're scientists, it's our job to understand everything. Well, our one specific narrowed scope of everything. And by not, it's easy to, as a scientist, think I'm always being objective. But then when I realized really far into the pandemic that I was getting really pissed off when my mom is telling her epidemiology PhD student daughter that she can't finish listening to her presentation on COVID because she can't trust her information because it's from China. I get so upset about that, but I'm upset. If I'm an objective scientist, that's not objective because I'm upset. And we are like, by letting emotions come in, I'm losing sight of the truth of one situation. Maybe their science truth isn't an actual fact, but it's true for their beliefs. That's it. Thanks, guys.
I want, I'm sorry, this will be my last comment, let other people jump in, but I think we might need to rethink, you just like all these objectivity, truth, emotion. I think we need to rethink the relationship between all of these, because I think people don't trust the notion of objectivity anymore. Scientific truth used to be isomorphic with objectivity and like universal reality, and that is not the world we live in anymore.
I agree with Mel. And I mean, for us thinking about these themes from the social sciences, this is a thing or an issue that we've been exploring for a long time. And you can really see historically how further and further the notion of objectivity comes to be separated from scientific research. The more people realize that there are many stakes and many interests at play when people do scientific research, the less one is able to believe or buy into this claim of objectivity. So it's okay to have emotions. You don't have to pretend that you don't. That's kind of the point, in a way.
May I?
Yes, please jump in.
I'm curious to know what people think of using a history as a instructional communicative tool for getting the public to understand the importance of science and public health. I'm thinking, but my big example when I was teaching was Stalin's academic purge and the effect this had on Russian science and agriculture. I saw this happening during the 4 years of the Trump administration. There was an academic purge taking place in the CDC, in the EPA, in the FDA. History, I mean, there's nothing new under the sun here. We've done this before. Would history, teaching history of the interplay of politics and science and public health be a good avenue to research?
My hot take, yes. The question, I guess, though, is, for whom? I'm asking you, Michael. In your
for education of science, the interplay with politics, and the importance of it to medicine and society.
Mm-hmm. Anyone else wants to comment, you can, but also Jonathan put a comment in the chat, and I was wondering if you wanted to just maybe say something about that or where you're coming from.
Hi, hey, thanks for the opportunity to just weigh in. This is a great conversation, and in particular, I really appreciate, Melissa, your urging to caution that the way that we even conceive of this problem needs to be more human. So I appreciate that, and I think the humanities really has a huge part to play in the anti-science conundrum. Because at the end of the day, if we are, let's say we were all scientists treating each other unfairly, it would be the same bad situation, so it's not scientificness per se that's creating harm, but it's humans not recognizing what I put in the chat, that actually no human is objective fully, can claim that, well, yeah, anyways, that's true, I think. And people are doubtful when they see some pose as completely objective, and it creates distrust. But if we were to recognize that every human has some epistemological basis that they commit to that is sound, and inside of them, they also contain beliefs that are not worked out, nor if they are, maybe some of them aren't sound. And so I think science and scientism is a specific epistemological view where your feeling, your understanding of the world is grounded by certain approaches. And there are religious communities, artistic communities, even other forms of knowing that aren't described by those categories that, hold on.
We can hear you.
Okay, great. Sorry, I was interrupted by a phone call. Sorry, I lost my train of thought. I'm just saying that that every human is a mixture, and I think inside of that mixture is possibility, because even the most sciencey of the bunch is going to have an opportunity and is going to have common grounds to speak with the most anti-sciencey of the bunch if they recognize that together they're the same. There's something in common here. That's what I have to say.
Thank you so much. This meeting will be ending in 10 minutes. Michael, I wanted to respond to something you said. Oh, and then Miriam, why don't you jump in?
Yeah, I have a question. Why scientists did not have a voice against discrimination for the Africa or some areas did not receive the vaccine?
Mm-hmm. Yeah.
Where is the trust? How you ask trust from community, and discrimination was there, and we were silent.
Wow. Yeah. A really good and poignant point. That makes me think of trust in a not just epistemic trust here, right? We're talking about like social and existential human trust. Gabriel, did you want to respond to Miriam's point, or does anyone else want to? I mean, it's a real important provocation.
Yeah, so I raised my hand for Jonathan's comments, but Miriam, I mean, I think it's a source of legitimate skepticism towards public policy. I think I personally, it's my personal opinion. Jonathan, I think, and also to bounce back to some of his comments in the chat about Galileo, there was this piece by Stephen Shapin, the great historian of science, before COVID in 2019, called, its title was "Is There a Crisis of Truth?" ? And he made the point that people don't distrust gravity or photons or photosynthesis or many components of, it's not just science. So it's another another take on what you said. I think there's a, and again, it's not, I don't think it's at the end of the day about science or being anti or pro science. It's some specific fields, specific applications of science and technology that are at stake right now, and that come with very strong social and aspects of injustice, like the distribution of these things. Yeah.
To piggyback on that, and also in response to Michael's question about like teaching the history of policy and science and their entanglements, people do that. It's in the social studies, science. There's a sociology of scientific knowledge, or science and technology studies. Even in the 70s, 80s, and 90s. Deconstructionist philosophy. I mean, which, and maybe Gabriel and Mark are more prepared to speak on that than I, but there are some people who go so far as to say, like, the reason that we're in this quote unquote post-truth era or in this predicament is because we had obnoxious social scientists and philosophers doing that deconstructive work of showing the politics of scientific knowledge projection, of showing how anything that claims objectivity is still socially constructed, that by the time it gets to the general public, this is what we get, right?
Maybe, sorry.
Yeah, go ahead.
Just like very briefly, this is something that I think I can speak about, because what you're referencing to is a European tradition, no, deconstruction and so on. I think that there was something, and I'm sure somebody has written on this, but I'm not a historian of philosophy, so I can't say, but I'm sure it's there, that there has been some sort of like something that got lost in translation, because never in the construction saying that something was constructed meant that it was fake. But when it was translated or this thought traveled into the Anglophone world, that kind of took on that characterization. And it amplified a sense of suspicion that was already somehow endemic. I mean, people started thinking about, I mean, there is that whole piece of Hofstadter, like the paranoid style in American politics, which predates deconstruction and talks about conspiratorial thoughts. So I think that there is some sort of like reinforcing feedback between a version of the constructionist philosophy and how it is represented in the US, and the public that it found here that kind of built off of each other. But deconstruction never meant to do that to begin with. And it took some time for American philosophy to catch up, in a sense, to that, like to like really figure out what it is that deconstruction was trying to do. If I speak from my tradition, from like my education.
I just wanted to I brought that whole Galileo thing up for a reason, and the reason I did is because it's traditional that nowadays the way we view Galileo is someone who is trying to search for the truth and is very objective, and that the Pope was very conflicted, that he had a lot of reasons for him to resist the ideas that Galileo was proposing, and that the conflicts that were in Galileo perhaps were there. Maybe there was some academic conflicts of interest, but the Pope's power that he had over the entire Catholic population was such a larger conflict of interest that you couldn't even compare. And that eventually, you know, Galileo was vindicated because his conflicts were less than those of the Pope. So I would probably disagree with Jonathan's assertion that these are equal. I'm a proponent that there is such a thing as truth, that we probably won't ever really know it, but I do believe that there is such a thing as truth, and that we need to work towards getting there. And I don't think we need to give equal footing to people with tremendous conflicts of interest as much as those with less conflicts of interest. And in a way, Michael Holloway's assertion that it's political has to be considered very important.
Well, yes, it's political because it's human. We're humans, right? I'm putting a link to my Zoom room in the chat because they will just kick us out in 2 minutes. And I do not expect anyone to join me, but if you want to, I'll be there. I'm having a early afternoon drink and would love to continue geeking out on this conversation with you guys because it's very, very stimulating. So on that note, why don't we just, before some of us just, get cut off mid-sentence, why don't we call it and switch platforms or switch Zoom rooms if we like, and otherwise, thank you all so much for this
Thank you, Mel.
conversation. Really awesome. Okay, maybe see you in a little bit.
Yeah.
Okay, bye.